by the public space. Okay, so this public space has its own distance, which is 10 to 12 feet. 10 to 12 feet. So what is proxemics? The study of the space in relation to
on how you communicate individually.
how you communicate. Which type of communication this is? Non-verbal,
Non-verbal.
usually. But why we have to study this? We come under the first category of the intimate, very closely associated while performing the phlebotomy. That's the, what is the distance? 18 inches. Okay. Next comes the personal space. For the personal space, 18 inches to 4 feet. Talking to a patient, giving instructions for the urine collection and all those things. And social space is 4 feet to 10 feet, right? This can be in a, you're just talking about the something else in the when you're working in the hospital. All the spaces are applicable, definitely when you are hired in a clinic or hospital. That's why I want to make sure that you guys know this. I haven't seen this in the slides or something. Yesterday I went through that, but I'm wondering if Munmun has taught this. So that's why I want to introduce this to you. Clear?
Clear.
And there are different branches of sciences that's been associated with proxemics. You have to know that kinesics, haptic, and all those things. But know this word kinesics. Kinesics is a term now. It has been in practice in the Waterloo and some other universities as kinesiology, the study of the behavior or the study of what do you call? It doesn't have to be like a talking one. It's the study of something that is associated with the physical movement, like gestures, something to communicate. You use hand movements or gestures to communicate to an individual. That branch of science is now called kinesiology.
Like body movements.
Body movement. Good job. Body movement. Clear?
Clear.
So you will get these questions somewhere in the medical field when you're attempting an exam. I'm wondering why they never introduced this to you. I got this question in CSMLS. Clear? Exactly. Now we're going to start. So how far you are in the revision? Are you okay, miss? 70%, 80%, 90%, 100%, 50%? No, miss, 0%. I never started. So it doesn't matter. Anyways, we are going to see this. Now I'm going to share this. I haven't. Okay, I'm going to share the what do you call the final exam review sheet. Are you able to see this?
Yes.
Yes, it is very small though. But
Very
we
small.
have it.
Okay, I'm trying to make it bigger. Okay. Okay, you have the paper. Can you see this now clearly?
No,
Yeah.
miss. Even the paper is very small.
I tried to zoom, but I don't know what's happened. Let me zoom it a little bit. Okay, now
You can't see the questions. That's the thing.
you can see now.
Cannot read it, but
No, ma'am.
I'm
So
going to
small.
read it. So you have the paper in front of you. I gave it to you.
Yes.
Keep it in front of you. Keep it in front of you. It's there on the table. If not, just you can write the answers by putting the number 1, 2. Then you can take the page, find it, and fill it out. Okay? All of you?
miss, the
Yes.
problem is the problem that I'm having. I cannot see the numbers in the crossword. So yeah.
That's why I'm telling you, do you have the paper in front of you?
Yes, I do.
Do you have a lens with you?
I have my glasses on.
Because this is even smaller, even I can't see properly, I use my lens. So
Yeah.
you can use a lens if you want to, because this is how they gave it to us, like in the format. Yes, Eveline, go ahead.
Yes, Mama. The numbers are different for the down and up. So I'm just going to write the answers here,
Yes.
which you can, yeah.
Later
You
on, you
can
can fill it. Yeah, but just you will note the answer. That's our point.
Yeah, thank you.
Yeah, there's so many things. Even I couldn't find the numbers properly. I'm also struggling. Okay. Now, shall we start? Yeah, good job. So across,
Yes.
find the number 1. Across, find the number 1. A bruise under the skin around the previous venipuncture. What could that be? You can raise your hand. I will just ask you. What could that be? Okay, or else I will ask. Asinath, are you ready? Yes, Yusra. Ready? Go ahead.
Yeah, it's
almost
hematoma.
fixed. Hematoma, sorry.
Hematoma. Very good. Hematoma. And the second one, this is basically the questions are there, but you should be able to figure it out, like what could be the answer. This is given in a tricky way because they want to test your knowledge in a deeper sense. So you'll be aware of what you're going to answer when it appears in the exam. You won't get a crossword puzzle like this, but you will be getting questions like this. Yes, Ying Hong?
Sorry, Miss. The sheet is very small on my screen. So is it possible where I can find the sheet, please?
You don't have the printed sheet?
Yes.
You have it? Then keep it in front of you.
Uh,
Keep
I
it in front of you.
to
Fill
find
it out. Or
Miss,
else just write, I
that
will read the questions, you write the answer.
Read out. It mean I can adjust the screen.
Okay, I'll
Oh.
just read the
Miss, I
questions.
think Ying Hong is asking because that week she wasn't in. So
Oh, okay. So in
Oh,
that
sorry.
yeah,
case,
so
I
she
will leave
doesn't
the
have it.
sheet. I'll leave the sheet with Munmun. She'll give it to you.
And me too,
Okay.
Miss. I was not there.
How many? How many of you need it? So I will just give
Yeah,
the
me
sheets.
too. Me too. I don't have it.
Yusra doesn't have it. Okay, I
And
will give it.
Asenet.
Just answer my questions then. Okay, just
You-
answer my questions.
Me too, I don't have it.
Ruziato, you don't have it?
No, I was sick last week, so I
Okay,
didn't.
I will note it down. So 4 crossword puzzles. Okay, I will leave it with Munmun. You can just grab it from her. Okay.
Thank you.
You're most welcome. Now just listen to my question and then give the answer. Site selected for venipuncture from a mastectomy patient. It says 2 words. Site selected from venipuncture from a mastectomy patient. We have to look for number 2, but of course it's very hard.
I can't see the number 2.
Even me.
Oh,
You
it's
can
down.
down.
Near
What is
number 4.
what
Yeah.
is that answer?
Opposite arm.
What is number 2? You know, in the middle part, it says non-mastectomy side. Site selected for venipuncture from a mastectomy patient is called non-mastectomy side.
Mm.
Okay, can you see 22? 22, sorry, 23?
Yes,
Across
ma'am.
23? Under this across 23, there's number 2.
Together with number 10 down.
Together with number 20.
Oh yeah, number 20.
Yeah, that number 20 is for the vertical, I mean down. So you have to fill it out, everything. Number 2, non mastectomy side. Fill it out. Non-mastectomy side.
Sorry, ma'am. I think I got a little bit lost. I just came from the washroom. What question is this?
This is the final exam review.
Yeah, but
And across we have started, one we have done. The second is side selected for venipuncture from a
number 2.
mastectomy.
Okay, got it.
So that is 2. Non-mastectomy side.
Okay. Okay, so from here. Yeah. Thank you.
Okay. Now, number 5. Number 5. Number 5, blood cultures aid in the diagnosis of this. Where will you find number 5? Across.
Blood cultures, that would be an infection, maybe UTI. I'm saying acronym.
Mm-hmm.
Is it UTI?
Where's the number 5? I cannot see.
Number 5 is close to number 9 across.
Oh yeah, it's
Back-
UTI.
Toma.
Yeah. Okay. Okay. Blood cultures. Okay.
Is it UTI?
Mm-hmm.
Mm-hmm.
UTI. Have you taken that?
Yes, yes, ma'am.
Ma'am?
Yes.
Yeah. Regarding this number 5, we're talking about the blood cultures, the blood. Isn't it supposed to be a septicemia?
It's not blood.
UTI will be a urine sample.
Blood cultures aid in the diagnosis of PUO, which means it's a type of disease, autoimmune disease. So blood cultures aid in the diagnosis of this. The acronym is PUO. PUO is something that is associated with the autoimmune disease.
Yeah, thank you.
Yeah.
PUO.
UO. Yeah.
Okay. Yeah.
Is something
That's
new.
one
I don't know
clear.
why they're asking you this. Is something new
Yeah.
that they have introduced regarding the autoimmune disease, but just to know.
Yeah. Okay, thank you.
Okay, you know what PUO is? Fever due to unknown reason. Yeah, this pyrexia. Pyrexia
Okay.
of unknown origin. Yeah, pyrexia of unknown origin
Yeah.
is PUO. That makes sense because it's a blood culture and we
Yes.
don't know what is inside. So the acronym
Exactly.
that they are using this here is PUO, which means pyrexia,
Pyrexia
fever
of unknown
due to unknown origin. PUO. Clear, all of you? I want to hear from everyone.
Yes,
Yeah.
thank
Azinet,
you.
Azinet, is it
Yeah,
clear? Ying Hong,
Yes, clear.
Maris, Zarina Mine, Chris,
Yes, miss.
Yes,
Yes,
Clear.
ma'am, it's clear.
Evelyn,
Yes,
Christiana.
yes,
That makes
yes.
sense because there's no way we
Yes.
have the UTI. So pyrexia
Exactly.
of unknown origin, which means, of course, we will be doing the blood culture when there is a condition, the high fever, the symptoms are not clearly known. And now we don't know what to do. The doctor will feel something is not right with the blood. Then only they give the blood culture, which means fever associated
Yeah.
with something we don't know. So pyrexia of unknown origin, PUO.
Okay, thank you.
We learned something new.
More
Good
s-
job.
Yeah, it makes
And then-
more sense because
Yeah.
UTI is
Yeah,
urine.
that should be the one. Okay, next.
Yeah.
Number 6, samples to be tested for this analyte are often covered in tin foil. This is a familiar one. Where is number 6? The problem is even I cannot see the number.
Yeah, they're
I'm
quite
struggling
small,
with the number.
small and fading.
Yes, okay, we'll try to learn. We are exploring. Where is number 6? First of all, it's on the
Far right.
side next to the, you know where it is?
To the
On
far
top
right.
of 25.
Yep.
Across top of 25, is it 25 or 23? 25.
25.
On top of 25, there is a number 6 across. I can enlarge this little bit. Can you see now? For the questions, I can take the paper. Can you see the number 6?
No, still very blurry.
Seriously?
Yes, ma'am.
Now?
Down of number 12.
Can you, now I have shared the screen. Can't you see this?
The number, no, ma'am.
We can
Next
see
to
the crossword,
Miss,
but
can you
not the
point
numbers.
where it is?
Here.
It's
Can
at
you
the
point
end.
where it
Okay,
is, Miss?
it's the extreme right-hand side. When you
Can
see
you
the
point
paper.
where it is?
Yeah, it's 6. I'm trying to, once again. When you look at the paper or when you're looking at the screen, it's on the extreme right-hand side across number 6. On top of 25. No?
Down of 24.
No, on top of 25. Across. Extreme right-hand side. Yeah, 24 is the one that's coming down.
In between down of 12 and 24.
Yeah. 12 and 24. Can you see the number 14, all of you? Can you see number 14 at the top?
Yes, ma'am.
Yes, ma'am.
Okay, come down. Come exactly down. There will be a number 24. Cross the number down. On the left-hand side, there is 1, 6. That's for the across.
Yes.
So number
Can you-
6 across.
Yeah.
Is Billy Rubin.
Yes, Billy Rubin. Very good. Billy Rubin, guys. Are you able to find that one? It's a little bit tricky, but we will do that. It's not that hard, but the numbers are very small. That's the thing. But you got it, all of you. You got the number, just write the answer. That's it. If you cannot fill this box, it's okay, no worries. We don't have to waste our time. Just note down the answers. Whenever you get the time, fill it in. Our point is to know the answers. Clear?
Here.
Yep.
Okay. Sample now, number 7. Samples tested for this analyte are often covered in tin foil. That's another one.
Keratin.
Keratin is fitting in.
It fits on mine. CAROTENE. 7 across.
7 across. To me, it's vitamin D. Keratin also is possible. Vitamin D. When they want to test vitamin D, they use also tin foil.
Sorry, is it B or D?
Da. That one comes from the sunlight.
Thank you.
Okay.
Yep.
Usually, Kara, instead of keratin, we say beta carotene because we have different keratins, alpha carotene, beta carotene. This beta carotene is the one which is highly sensitive for that. So we don't have space for the beta carotene.
Okay.
So vitamin D, yes, vitamin D makes more sense. Okay.
Yes.
Good. Good job. Next one. This is the deepest incision allowed for an infant heel poke in millimeters. We have to write. The
2.0.
deepest incision allowed for an infant heel poke. Number 9. Number 9 across before 5. Any idea?
I don't know.
Infant, for infant, the maximum is
2.00.
2
mm.
Yeah,
2.0
2 millimeters. So TWO.
Oh.
TWO2. Oh, we are learning alphabets.
But there's another space.
Mom, there's another space. It's like 4 space all in all.
Yeah.
So
Maybe
it's maybe
2.00 or
yeah, 2.0. It's a millimeter, but that's the max for an infant. That's a max for an infant. You can write millimeter in that because I think it's not used for anything. So 2 is the maximum, TWO. Okay? Hello? Are you guys there?
Yes, okay.
yes.
Yes,
Yes,
thank
ma'am.
you.
Yes.
Yes, ma'am.
Okay.
Thank
The
you.
clarity of a lipemic sample. Number 13. Lipemic sample. Number 13. It's at the top. Left
Milk.
side of 14 down. You have the number 14 at the top. You can look at the left-hand side.
Cloudy.
So would it be cloudy or milky?
Cloudy, yes, cloudy. Good. Cloudy or milky. Very good. Good job. I picked cloudy.
That's right, cloudy. Cloudy.
Cloudy will be the correct one. Milky will be short for that. Yeah. The next one. This analyte, number 15, okay, across. This analyte may be falsely increased if betadine is used to cleanse the finger during a capillary collection. Now, betadine is a chemical that we want to use if we don't have to use the isopropyl alcohol. It's an antiseptic. What will happen when you use the betadine? What is the result of this? Will it alter any analyte? Yes, there's a possibility of altering an analyte. What is that? Number 15. What is number 15?
Potassium.
Yes,
Is that potassium?
potassium. Others agree? 15.
Yes, ma'am, it
Yes,
is.
increase
Yes,
the
It's
potassium.
different.
Potassium.
Yeah.
Very good. There is one more thing that increases the or alters the potassium. What is that?
The uric acid.
Hemolysis.
Hemolysis.
This is hemolysis.
Hemolysis or long. If you leave the tourniquet for long, it alters
Oh
the
yeah,
potassium.
hemolysis.
Yeah. Okay, very good. Number 16. This analyte may be falsely increased if betadine is used to cleanse the finger during a capillary collection. So alternatively, they are giving the different options here. Where is number 16? 16 below 18 down. So what is the answer? Phosphorus. So one we have learned, betadine can alter the potassium. Betadine can also alter the phosphorus. Both starts with PP. PP. Clear?
Sorry, what did you say about 16? What's the answer for 16? Sorry.
Phosphorus.
Thank
Phosphorus. PHOS. PHORUS. Phosphorus. Where can you find the phosphorus? In the body. Bones. It's involved with the bone density, bone metabolism. Clear number 22? Are you guys ready for number 22?
Yes.
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 22 is represented by the UN number 1845. Where is number 22? UN number 1845. It's at the top, below 19. Top, you can see the number 19. And on the left-hand side down, there's number 22. What is the UN number for 1845? Most of the time, I have seen this question. It is important for the TDG because it's used in the packaging.
Dry
ice.
Carbon dioxide.
Dry ice.
Not carbon dioxide, dry ice.
Oh, dry
Yeah,
ice.
it
Yeah.
is. Yes, it's
It
a
is
form
a
of
carbon dioxide,
yeah,
but
it is
the
yes, in the
no.
form of ice. Yes,
Yes, because
It
it's
says
that's why
solid.
it can
solid.
explode.
Dry.
It is solid.
It's solid and it explodes when it is like disturbed.
Dry.
Dry ice. Then the next one. When you talk about the carbon dioxide, usually it refers to the gaseous state. So it is a compressed carbon dioxide.
Solid carbon dioxide.
Okay. Solidified carbon dioxide. Okay, next, number 23. Transportation within the lab. What is the terminology for within?
Outside.
Intra. What is the terminology for in between?
Enter.
Very good. So this is, where is the intra? What is the intra here? Intra lab. Where is the intra lab? Yes, number 23 is about 2 across. On top of non-mastectomy side, there is, on the left-hand side, there is a number 23. Come down. Come all the way down. Here. I don't know how to use the pointer. Maybe I can try.
Laboratory.
1 second. Let me grab this. I'm doing something tricky here. Can you see this one? 23 now? Yes.
Yes, ma'am.
Oh, it's a good idea. It's working. Can you see 23?
Yes.
Yes.
Yes, ma'am.
Intra-laboratory. Intra-laboratory. Number, are you okay with this? All of you, I want to hear from everyone.
So the answer is intralaboratory?
Intra-laboratory. So ready for number 24?
Yes.
Where is number 24? What is the question? TDG category for infectious substances. TDG category for infectious substances.
Category A.
Category?
Category 6.
Category A.
Where is the number? I'm looking for the number. Here. I saw somewhere. Just 1 second.
It's in the same row as 14 down.
Yeah, 14 down. Yes. But that is for, do you think that's for that one?
That's for down already, ma'am. Yeah, the 24 is down.
24 is
What is the
down?
question?
Yes.
No, 24, I think, is just the A.
Yeah.
Just, oh, okay.
Yeah,
Makes sense.
TDG category
Thank
for
you.
infectious substances.
Because
I
it's
thought that we
category
don't
A.
need to write all the category A.
No, no. So have you found the 24?
Yeah, only one box.
So
Only
is it
one box.
14
24.
symptomatic?
Now, TDG category for infectious substances. Is it,
I think that one was. Let me check my paper.
where did you find that, guys? I'm looking still. Sorry.
I cannot,
Eyes.
I
Okay,
cannot find the
it's like
24.
It's
hold
under
on.
14.
Under 14.
Yeah,
Oh,
under
under
14.
In the same row as 14.
Hmm.
Besides number
One
3.
under.
For infectious substances, category A. So this is the one. Just A. Category A. So category B is a different one. Okay. The next one, 25. The type of packaging placed between the primary and secondary packaging for classification 1B. This we know, it's 25 is here. Can you see 25?
Yes.
Maybe I have to use darker color. Yeah, this will be fine. 25. Yes. $25 is done. 26, the name of the additional tube drawn when collecting a coagulation test
Get the answer
using a
for
butterfly.
25.
Ma'am,
26.
what is the answer of
It's for
25, please?
25.
Oh, I never gave the answer.
Nope.
Absorbent. 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 SORBENT. Absorbent. Something that absorbs any leakage or something coming out of the package. The absorbent should be in between the 1 and the 2. The first one and the last one. It'll be the third thing in the package in between. Where is, now is it clear? We are going to number 26. Number 26 is here. Can you see number 26, red?
Yes.
Yes.
What is that called? The question is the name of the additional tube drawn when collecting, yes, discard tube, very good. DISCARD, discard. Discard tube. What about others? Are you guys okay? Can you see?
Yes.
Yes, we can say.
Yes.
Yeah, now you can see clearly, right? Okay. Name of a test used to diagnose pinworm. Oh, wow. This is a
Stool
question.
test.
27. Where is this number 27? It's there. Here. Can you see the 27 now, the red?
Yes.
What is the name of the test 27? Scotch
Stool
tape.
test. Oh, it's Scotch.
Scotch tape is the one that is fitting inside. SCOPCHTAPE. I'm repeating. SCOPCHTAPE. TCH, Scotch. TAPE, Scotch tape. If you use sticky paddle, it's lengthy. We need 2 more boxes. So this is the one that's fitting inside, Scotch tape. Good. Number 31. Number 31, I'm clicking this, number 31. You can see the 31 now? Yeah. Would not be used to test for glucose if sample was collected in a sodium fluoride tube. Would not be used to test for glucose if sample was collected in a sodium fluoride tube. I went for chemistry. No, sorry. Would not be used to test for glucose if sample was collected in a sodium fluoride tube. It means, it says it's not chemistry. It says chem strip. This is a new word that has been introduced here. It's like CHEM STRIP. Chem strip. Chem strip is the strip that they use to test the for the glucose. Chem strip. Chem strip.
Miss, are you talking about the gray top tube, right?
Yes, there is a strip. If it's not used to test the glucose, there is another way of testing. There is a strip that's used to test something. That's called the chem strip.
Okay.
Chem strip. It's a new thing. But anyways, you will be coming across so many different tests when it comes to the testing lab, when you're in the testing lab. So just know about that, chem strip.
Is it the strip that they put into the glucose like monitor machine, or that's a different strip?
That's a different strip. This is a different strip that they use.
Oh, okay.
Chem strip. Okay, that's for the urine.
Oh, okay. Thank you.
Yeah. But usually these strips is used to find any metabolic disorders. Because it's telling sodium fluoride tube. Sodium fluoride tube is for the preservative, right? Preservative of what? Sodium fluoride is a preservative of
Glucose.
glucose. Yes, glucose. Okay. This question doesn't make any sense to me. I don't know why they have asked. It should be this question should have been in a different way, but they never asked it properly. The next one, is it clear? Chem strip, what they mean to say, if they are not testing it in the chemistry department, what is the other way of testing it? Is the chem strip. That's it, to know the glucose. Is it clear? Now down. Down. It starts from 3. I'll use a different color. Can I use a blue? Yeah, blue. Number 3. Number 3, I have to find number 3. Yeah. Can you see the blue? Number
Yes.
3, down blue.
Yes, ma'am.
Oh, it's
Yes,
coming as
miss.
a whole row. So can you see the 3? Number 3. Okay, now the question is, term used to describe blood culture set collected from one arm immediately, followed by another set collected in the opposite arm. What is that called? Oh my God, this is really, really the way they ask. It means if you're doing something in one hand, and simultaneously you're doing it as a continuation in the other hand, we call that consecutive.
Consecutive.
Yeah, that's what they're asking here. But we don't want to know the grammar here, consecutive. Consecutive. Maybe they use in the medical field just while taking the blood, consecutive tubes. I haven't heard about this. Consecutive. You want to know the spelling? CONSECUTIVE. Consecutive. There is another word that can be used, but it's not fitting in simultaneously. Simultaneous is like the other way, like the continuation of something, if I'm right. Done? Yes, no,
Yes, I'm done.
okay. Yes, no, okay, wait, no, continue.
Yes,
No
madam.
response. Yes, very
You
good.
can continue, ma'am. Thank you.
Number 4. Number 4 is there. I have clicked the number 4 down. Can you see all of you?
Yes, ma'am.
Yes.
Okay. Liquid portion of blood that contains coagulation factors. Everyone must know this answer at this time.
Plasma.
Plasma.
Very good.
Mhm.
Now, if I'm asking you as a liquid portion of blood that contains no coagulation factors, which
Serum.
means
Serum.
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 Very good. Very good. The next number 8. Where is number 8? The problem is, even if you know the answer, it's hard to find the numbers. Yeah, I got it. Number 8 is here, towards the left-hand side. Can you see the blue here? Towards the left-hand side of
Yes, ma'am.
16. Left-hand side of 16.
Yeah.
The question is,
56.
samples tested for this analyte are often covered in tin foil. There's one more tin foil. This is something really, really strange. It says methotrexate. You don't have to worry about this. No one is going to ask you methotrexate. Potassium possibility, okay? And carotene possibility. But even phosphorus, they're not going to ask you. This is just knowledge base. It says methotrexate. The spelling is METHO, metho or metho. Trexate, TREXATE. Methotrexate. You don't have to worry about this. This is too much for you guys. They're asking on their own, from their own point of view. It doesn't make any sense. Methotrexate. It's good to know, but you don't have to break your head for this. Can we move on to the next one? Number 10. Let me locate number 10. Where is number 10?
It's
I
in
saw,
the
Right.
I saw
right
somewhere.
side. Right side,
Yeah,
the
yeah,
last
extreme
the
end, extreme
last
end.
down. Yes.
Extreme end. So I will use a different color. I think blue and yellow makes green, guys. So let me try this here. It will become green. Now 10, green. Can you see the dark green? 10. Yes, no. Okay. We
Yes,
are
ma'am.
looking.
Yes.
Yes, something should come, right? This test value may be inaccurate if a skin puncture has been taken from a site that is too cold or the patient has poor circulation.
Hematocrit.
Hematocrit. Hematocrit. Now, what is the spelling for hematocrit? Amina?
HEMATOCRIT.
Hematocrit.
Yep.
Hematocrit. Now, I have a question. If you are done, just ask me. What is that question?
Mom, what is
Yes.
the hematocrit question? Number 24?
Number 10. Number 10. The
Oh, number
question, number 10. The question says the value will be inaccurate if you're performing a skin puncture. And that too, if the hands are too cold. If the hands are too cold, you won't get the proper result. Okay. And if why they are called as poor circulation? Maybe they are anemic or some other disease condition. So that's what they're asking, which means the volume, the RBCs will be less. So the packed cell volume will be less, inaccurate. That's it.
Thank you. I got it.
Yes. Yeah. Number 11. You're most welcome. Number 11. I saw somewhere number 11. Yeah, here it is. The yellow one. Can you see the yellow one? Or do you want me to change some other color? The blue is used, a pink. We can use the pink. Pink is now, can you see the pink? It's cool. Something NMS card should not be exposed to. This is a tricky question. Something, what is this NMS card? What is NMS card?
I think
You know,
it's
the neonatal screening
Neonatal
card.
screening.
Screening card shouldn't be exposed to something. What is that something? The something is
Dry card.
bleach fumes. It says bleach.
Okay.
Bleach fumes, which means totally bleach.
Bleach.
So bleach fumes. Number 11 is bleach fumes. BLEACHFUM. M as in monitor. ES. Bleach fumes. Bleach fumes. Bleach fumes. Now, number 12. Where is number 12? I have seen number 12. Look for the pink, okay? I'm going to click number 12 for pink. I have seen somewhere. Oh, yeah. The pink one is here. Towards the right side of number 30 or in between 30 and 24 at the top, you have number 12. Can you see number 12, the pink one?
Yes, ma'am.
Yeah, number 12. The number of hours after birth, that is the best time to collect an NMS card. The number of hours they're asking.
24.
24.
Yes,
24.
24.
Yes.
24. TWENTYFOUR. 24. Okay. The next question. What is number 14? 14, I saw somewhere. 14, yeah, the 14 is here. Look at another pink towards the right-hand side of 12 at the top. Can you see the pink?
Yes.
The term used to describe people who unknowingly harbor an infectious organism in their nose, which means that this infectious, whatever, virus, bacteria is sitting inside the nose. What is that called? Asymptomatic.
Asymptomatic, okay.
Asymptomatic because they don't know, the symptoms are not clear, nothing has been developing physically, we cannot see, but they are sitting inside. So asymptomatic, which means the infectious thing is there, symptoms are not seen. So we call them, sometimes technically in medical field, we call them carriers or vectors.
I think it is asymptomatic carrier to complete the whole line.
Asymptomatic carrier, yes. Asymptomatic carriers. ASYMPTOMATIC. Another C, ARRIERS, because they are asking the term used to describe people. So it's plural. So asymptomatic carriers. Sometimes the same term, if it is a short table, we call that vectors, VECTORS. So just to know, okay? But here it is asymptomatic carriers. Thank you, Amina, for that. That's 17th one. 17th one. This analyte may be falsely increased if betadine is used to cleanse the finger during a capillary collection. How many times we have to know different things, right? Number 17. You know where number 17 is?
In the middle of hematoma.
Ah, the middle of, at the top of hematoma, I would say. Yes, very good. Uric acid. So with the usage of betadine, what is falsely increasing here?
Uric acid.
Before that, we have seen something. What is that?
The potassium.
Potassium and
Phosphorus. Two P's.
Phosphorus.
Phosphorus. So this is now how you are learning. So it should come to your mind when something is increased, if the options are given A, B, C, D, E, uric acid is given, click uric acid. Or if phosphorus is given, click phosphorus. Or if potassium is given in the options, click potassium. This is how you have to pick the answers. Good job. Number 18. Where is number 18 is here?
Near number 16.
Near number 16. Now the question is, the technique used for fluid collections. The answer is aspiration. Aspiration. A-S-P-I-R-A-P-I-O-N.
I remember that term when you were talking about suprapelvic.
Suprapubic. Yes,
Pubic,
I recalled it. I was thinking in my mind to ask about this question. Good that you brought it. Usually the way they use is different. For example, aspiration is like a verb now because the technique is there. But sometimes they can use aspirant, aspirate, but the whole thing is the common. Something is taken out, the form of a fluid. Clear?
Yes.
Now 19. Where is number? Yeah, it's here, sitting at the top, towards the right-hand side of number 22 across. There is 19. What does 19 says? The time when the therapeutic drug levels will be the lowest. It says trough, T-R-O-U-G-H. I have to explain this trough now. Trough. This is like a curve that is used to monitor the drug levels. If the curve is really in the form of a graph, so in the patient's body, if the level of the therapeutic drug is very low, we call that part as trough. And when it goes at the top, we call that peak. Clear? Okay, for example, no answer? Yes, no, somewhat, nothing. Nothing is clear. Okay, usually in the medical field, whatever they are monitoring, they will record it in the form of a graph. So this category comes under the drug monitoring in medical field. Therapeutic drug monitoring, or TDM. You will come across this TDM in your skill books as well. There is a term in the skill books you will be learning in the chemistry. So the TDM, therapeutic drug monitoring, what do you mean by therapeutic? It's a drug that is administered by the physician due to some illness or metabolic disorder, but taking for a long period of time may be toxic to the person. Or it may affect some other organs like kidneys, liver. So in that case, they may show some symptoms. That's not good for them. So they will go to the physician. Now they will be tested using which tube? Which tube?
Royal blue.
Drug.
Royal blue.
Okay. Royal blue. Even they can test in red also.
Red.
If it's serum. So now the doctor will monitor them. And they will monitor and record it in the form of a graph. So in that graph, in the early morning, the drug levels actually will be low in the blood or in the urine. In the urine, most of the time, it will come up in the form of enzymes or hormones. And sometimes that's why they have to collect for 24 hours. If in that case, if you're testing for urine. But we are talking here about the graph. The graph which shows the low level of the therapeutic drug is called trough. When the therapeutic drug level is high, it's called a peak. Clear?
Clear.
One
Yes.
clear?
Yes, ma'am.
I'm going to ask everyone. Azinet, clear? What? Tell me yes or no.
Clear, miss. Go on.
Ying Hong,
Yes. Thank you, ma'am.
you're most welcome. Maris,
Yes, ma'am. Clear.
Zarina Mine, Eveline,
Yes, ma'am. Clear. Thank you.
Christiana. Christiana, are you there?
Yes, I'm here. It's all clear, miss.
Zenaida, Amina,
Clear, ma'am.
Yes, ma'am. Clear.
Chris, Joanna, Shabana, Lewis. Now, in this particular topic, we learned different words. We confirmed that the SST red, serum red can be used for the drug monitoring. And we confirmed the royal blue tube is used for the drug monitoring. We confirmed that the drug is not that good if taken for a long time. We confirmed that this is monitored in the form of a graph. We learned two new terms. One is the trough and the peak. Clear?
Clear.
So
Yes,
Rugiato,
clear.
Santiago, Yusra, Kara, Huda, Verna, Louis, Shabana, Joanna.
I said
Clear?
okay a long time ago.
Yes,
Okay.
we're okay.
All clear, ma'am.
All clear, because I want to see if you're sleeping or awake. Because this topic
Awake.
is awake. Very
Yes,
good.
we're awake.
Very good. Now, the next one. The preservative used for ova and parasite. I am not going to tell you. This is something very important. I told already. Where is number 19? First of all, it's at the top.
The very bottom.
Oh, the bottom. Where is it? No, the
PVA.
20. Number 20. Sorry, guys. Number 20.
Staff.
Yes, SAF. Very good. Can you see? I'm just going to highlight the pink here. SAF. Now, my question is, what is SAF?
Sodium acetate acetic acid formalin.
Who is this?
Verna.
Good job. What about others? Because this SAF is important. SAF is important. Sodium acetate, acetic acid, formalin. The next one, 21. Name of the guidelines put in place to protect the public during safe transportation of materials. 3 words. You all should know by this time what is the 3 words that we use for transportation.
TGD.
TGD. I want in the form of
Transportation
words, transportation of
of
dangerous
dangerous
goods.
goods.
If it's if they ask you in the form of abbreviation, then give them TDG. Otherwise, you have to elaborate transportation of dangerous goods. Clear?
Clear.
Yes.
Yes, clear.
And this TDG is important whenever you're going to attend some exam, you're going to attempt even the MLPOW, the final exam, this final exam for lab safety, even for CSMLS, TDG, WIMIS, TDG are very, 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 very important. Put that in infinity. Definitely you'll be bombarded with questions. Because for all the other medical professionals, they also have to know thoroughly about the TDG rules and the WIMIS rules because it's for the safety. And as you know, safety comes first. The next one. Test done as a colorectal cancer screen, number 28. Where is number 28? Here it is. Can you see the 28?
It's the fecal test.
Immunochemical test, FIT test.
It.
FIT.
Fecal.
Remember the one for the fecal occult blood test, FOBT? That's the primitive method. Oh, sorry, not the primitive. The oldest method that we used. Now they have, I told you, in Life Labs, that's the one lab that's using an advanced technology. It's a flat tube. I mentioned this particularly
Yesterday.
because I'm seeing there. And I have brought one to the lab for identification. When you come to the lab, I will show that to you, the FIT tube, because no other labs use that. Only Life Labs use that. And that goes to biochemistry in the analyzer directly. The results are printed out. I'll show the tube when you come, okay? But Dynacare use the FOBT, the oldest method. They don't have the FIT tube. FIT tube is used, I don't know about the hospitals, you can ask Monmon, but we use the FIT tube in the testing department. And then the next one, it goes to biochemistry. It's associated with the microbiology. Sometimes it's very close to the molecular biology department. So in Life Labs, in the testing area, this biochemistry department is close to the microbiology. Now, chemistry itself is a different lab. Biochemistry is a different lab. So this goes as a biochemistry assay, okay? A biochemistry test. Clear?
Clear.
Yes.
Okay. Yes, Luis? Is it Luis or Santiago? Everyone is fine?
Yes.
Okay.
Yes, thank you.
You're most welcome.
Fine.
Number 29. Number 29. Where is number 29? I saw somewhere. I can see 30, but where is number?
What shape is across 27 across?
Oh,
Around.
across, oh, yeah.
Yeah.
Oh, yeah. 29. Okay, at the bottom of 16, guys. Yeah.
Yeah, at the bottom of 16.
At the bottom of 16, what does it say? What is the question? It says, test that assess the degree of malabsorption by determining how much fat is excreted in the stool. This is the topic that we learned yesterday. What is that called? Fecal fat. Fecal fat. So how will you know about this fecal fat? Which will be the sample?
Stool.
The stool. The stool. Just to bring it to your attention, I want to talk about the fecal fat that I attended a webinar yesterday with the lab sciences. They discussed a lot about an interesting factors related to the diarrhea and its symptoms, why it's happening. And then they talked about the fecal fat. I will just explain a little bit about that as a parasitology, but now after completing this one, I will just go through that, why fecal fat has to be considered something as an important thing when it comes to the diagnosis. Because it's associated with the parasites. When some parasites are sitting there in the stomach and they are multiplying, then they will cause the fat metabolism to what do you call? The fat metabolism will be affected. And in the diarrhea, they will be getting the fat. It is not absorbed properly by the intestine and it's not used properly. So the fat is accumulated in the intestine and then they get the diarrhea. This is an interesting fact that I came to know yesterday. So I was recalling about the class. I thought maybe I have to talk about this to the students. So when you know about these things, it's interesting, right? And you'll be aware of these things. You'll be careful. You'll be more aware of washing the hands and avoiding the unnecessary stuff when you see, especially when it comes to hygiene. Question number 30. The number of sputum samples often required for cytology. The 30 is here. Sputum sample, what can that be? Oh, it becoming purple or blue? This one. Can you see next to on the right hand side of 11? down, you will see something that's a 30. What they're asking here, the number of sputum samples that you have to collect when you're working in the histology cytology department. How many times you have to collect from one patient? 3. You have to collect 3 times to double check and to confirm. To double check and to confirm. Clear?
Yep.
Yes, ma'am.
Okay. Sorry.
It's a follow-up question, ma'am, on number 30. So if the collection is, will it be done early morning for 3 consecutive days or can be collected in one day?
It depends on what they're looking for. Maybe they can tell you to come the next day, or
Yeah.
I think they want to see something like in the form of a lung cancer or something.
That's right.
Yes, even for the AIDS patients, because they are immunodeficient.
Yes.
So if the doctor wants to see different things, they don't go in a rush because it takes time. And then it all has to do with the testing procedure by the pathologist. So they will go for this.
Okay, thank you. Yeah,
You're most
thank you.
welcome. Any questions regarding this, guys?
Ma'am, I have a question regarding number 21, down.
21 down?
Yeah.
Doesn't contain
On the
the
puzzle,
TGD.
the answer is transportation of dangerous goods, right? But
Yes.
the 21 down on the crossword puzzle, it's
dangerous goods regulations. So that's what it's been mentioned. So dangerous goods regulation is 21. Name of the guide, sorry. It's the guidelines. Yes.
so dangerous.
So dangerous goods regulations. You can take it as dangerous goods regulations. Let me see.
It fits.
Yeah. Dangerous goods. So the guidelines are usually, they are regulations. Regulations or act, but here the guidelines, I'm sorry guys, I never noticed that. So guidelines means like they are the one, they guide you like what to do, and that can be in the form of an act, ACT. So sometimes dangerous goods act is okay, and if there's a more lengthy puzzle, transportation of dangerous goods act will be applicable. But here it is dangerous goods regulations. Regulations. Yes.
Okay, ma'am. Thank you.
Any other things that I have to know to alter? But is this clear? Everything? Some of the things you won't be getting the trough and all that. Just good to know. Explained to you about the trough and the peak. And the one next is the next one. So we are going to, I'm going to ask some flashcards and questions. And remember one thing, whatever you have attempted in the test 1 and test 2 of the previous lab safety, be thorough with that. Questions mostly which appear in the final exam is a repeat question. For majority of the time, you will get at least like for out of 100, you will get 50 questions. That's the rule. So make sure, be thorough with it. At least you don't miss those parts because 70 is the passing mark. 20 can be new for you, but the 50 can be definitely a known package. So don't ignore those questions. If you can just bring it into your memory, go for it. And they are easy. So based on the flashcards today, I can ask you those type of questions completely. It will be like a repetition. Some of them will be new. Some of them might have been twisted and asked. Don't ignore the previous ones. Okay? Don't ignore the new friends. Don't ignore the old friends when you come across the new friends. That's one thing. Okay, let us move on to the flashcards. Topics and do you have all the other papers? So I have recorded here 4 crossword puzzle sheets have to be printed and distributed. Is anyone in need of the revision sheets that I have gave it to others? I believe some of them asked for it and I gave it to them on Friday for the absentees as well. But if you are missing something, let me know.
Yeah, it's with Evelyn.
Yes, I forwarded to Asinet.
Yes, sir.
Yeah.
Okay, I think I gave it to majority of them. They took someone took it for Shabana, someone from for Rugia too. So
Yes,
I want
miss,
to make sure if you have got those sheets, you don't have to miss the revision part. As I'm telling you from my experience, what I am seeing, students sometimes they know the answer. This is my experience, but they don't know how to choose the right answer, or they don't know how to read it, or something they interpret in a wrong way. That leads to the failure or losing marks. It shouldn't happen. We are here for a reason. We put so much effort, and then we come here with great difficulty. 9 o'clock to be in the class is not a joke for majority of them. I understand. Leaving the kids in the daycare and then rushing in the traffic. Oh my God, coming from distant places. So keeping all that in mind, I decided that revision is I even told the college, no matter what you teach, if the concept is not clear for the students and if they don't do repeated revision, it's a waste. Do you guys agree?
Yes.
Yeah.
I agree.
Yes.
200%.
Yes.
I agree. Yes, because they can, if they retain the information properly, even after some time, when they just take the book, when they just review those things for the MLPAW exam, it will be there fresh because the concept will be clear, and there is something they might repeat it again in the class, and now they are not going to forget. Even if they forget, it's only a little bit, so they will pay more attention. They become more motivated. That's my point. Why I have to tell clearly about the concepts. Wherever you go, the concepts, the foundation should be clear in you when it comes to the subject. This is my goal. So I appreciate your cooperation in that. Okay, I was talking about the fecal fat, right? The fecal fat is something that is happening because of some malabsorption of the fat in the metabolism or in the digestive system. But there is a parasite. I told you I attended a webinar yesterday. It's really interesting, all about parasites. I love the parasites or germs that's not seen or that is seen, both. I enjoy them. The way they move, the way they look, the way they appear, so everything. What that scientist, he was a scientist, he mentioned there is a parasite called Giardia lambella. It's in the tropical countries. When it's usually it's there in the soil or mud, but when they get infested with this type of organisms, the parasites, the eggs mainly, they go inside the intestine, they hatch, and they start multiplying. And this one, we call this giardiasis. It leads to dysentery, and they will have this fat in the stool. So mainly, it's not only the chemistry, it will be associated with microbiology as well. So when you are there in the microbiology, as a technician, keep this in mind. You have to find the Giardia. That'll be the standard operating procedures of how to take it out from the feces and everything the technologists will do. But this is for your information. When you deal with these type of samples, make sure the PPE is in good condition and handle it properly. Clear?
Yes, ma'am.
Yes.
When
clear.
you have to talk, you don't talk. When you don't have to talk, you talk.
Actually, I remember that parasite, ma'am. It's a falling leaf motion when they are alive under the microscope.
Yeah.
They look like an octopus.
They
Oh,
move.
it's an old man with an eyeglass. I used to, I've seen that when I was in the Philippines. In my internship.
But you know, that scientist said it's a cute parasite. Someone asked, like, have you admired any parasite like that? He said, it's very beautifully, it's flagellated. It has like a hair-like thing to move. It's
Yes, that's
flagellated,
true.
and it is, he said, it's a very cutest parasite, which means it's
True.
under the microscope, it looks really cute. That's what it means. Okay, but look, that causes the fecal fat thing in the stool. Okay, while collecting the sample, while receiving the sample, not collecting, while receiving the sample, you have to be very careful while dealing with all these things. Okay, wash your hands properly and wear the PPE properly. So let's move on to the flashcards. Any other question? Any other doubt?
No.
No. Let us
No,
grab
thank
the phlebotomy 2 review first. We haven't completed that. Do you remember? Phlebotomy 2, part 2. We stopped at 12. No, how many? 13. How many times maximum should you poke a patient whose veins you're having trouble? Look, yeah, this
2 times.
2 times, we know. By law, right? By law. So take that sheet, question number 14. Do you have the sheet? You need time? It should be
No, we
there in
have
front
it.
of you.
I
Tomorrow
have it.
also, yes, bring the whole bunch of lab safety, equipment safety review. Keep it in front. As I told you, you have to retain this sheet in a separate folder because this is a major module. If you just review all these questions, it's good enough to pass. Okay, question number 14. Is everyone ready? I want to hear from everyone. Otherwise, I'll
Yes,
assume you
ma'am.
guys are sleeping.
Ma'am.
Ready.
Ready.
Ready,
Okay.
ma'am.
Now,
Yes, ma'am, we're ready.
define the following for a light blue top tube. Anticoagulant to blood ratio. By this time, you should be thorough with this. Every time you'll get a light blue. Yes, Yusra. Anticoagulant to blood ratio. Look at the question. Yes, Yusra, go ahead. Hello.
Hi, it's Kara. The
Kara,
anticoagulant to blood
yes.
ratio would be 1 to 9.
1 to 9. Yes, very good. So look at the question. And blood to anticoagulant ratio? Yes, who's the next person?
9 to 1.
9 to 1.
9
Yes,
to
very
1.
good. 9 to 1. Describe now. I will ask. I have the students list. You have to just raise your hand. Discuss how the above required ratio is affected by a winged collection. What would happen to the specimen when it arrives in the lab? How do we adapt our method to ensure a good collection? Now, this is important. Have you heard about the aerobic, anaerobic?
Yes.
Yes, ma'am.
Who knows the
Dr.
answer for this question? Who knows the Kara? Yes, go ahead, Kara.
Are you asking like if you used a butterfly on somebody who wouldn't necessarily need it? What could happen to the blood, like the sample?
Okay, if someone is using a butterfly.
Yeah.
Okay. And yeah, how will you continue with the blue tube after doing the butterfly?
You have to do a
Using
discard.
the star tube?
Discard tube, very good. Yes.
Discard tube before you start the collection.
Why?
Because of the air in the tube. In the tube. Butterfly needle set.
Yes. So when you're doing the regular needle, you don't have to discard anything. Why? Blood culture, anaerobic, and then it will continue. Or as per the order of draw, there'll be a blue tube, and then comes the SST, right?
Yes.
Or red, and then the others will follow. But if it is a butterfly, then you have to use a discard tube. You collect a little bit of blood, you discard it, and then you continue with the blue. The reason is the air will be the interference in that. It should be an anaerobic condition when you want to draw the light blue. Why? It affects the chemical components of the clotting factors. That's why we are doing this. Contrast the following terms: biocide, fungicide, viricide, etc. This is a good question. But remember, question number 15 is very, very important. Even it is given in the slide in the previous units that you have done with Moon. Even it is there in the phlebotomy book. When you go to the lab or when I come back, I will make sure that you know this component, because this is the light blue. The light blue, you have to underline using red mark. Every time you'll get something about the light blue tube. Light blue is important. Now, it says, what is the biocide?
Substance that destroy living things.
Living things, very good. Biocide. Side is something to, mainly chemical that can kill.
Yeah, it's a chemical compound.
Compound that can kill any life. That's a biocide. Fungicide.
A chemical that destroys fungus.
Fungus. Viricide.
Chemical that destroys virus.
The best example, in my perception, I would give the 70% isopropyl alcohol, because they say if you use that can arrest this fungi, algae, everything, spores. Okay, but still we autoclave for some of the things. It is true. Exception is us. We use it on our skin to eliminate all these things. It's a good biocide. Exception are human beings. And mammals, I would say mammals. But my cat has irritation for this, which means it can cause allergies in animals, in pets, but they don't kill the animals, the mammals. But definitely it can eliminate the virus. It can eliminate the what do you call, the bacteria, the fungi, everything. That's why it's considered as a best antiseptic. Clear? The next one, 17. Contrast an antiseptic with the disinfectant. What is an antiseptic? What is a disinfectant? Give an example for each of them. Indicate where this can be used. Yes, Varna, go ahead.
Antiseptic is a substance that inhibits growth of or kills disease-producing microorganisms. This usually applied to living tissue.
Living tissue, yes. Example venipuncture, yes.
Yes, ma'am. Example, before you start the venipuncture, you have to apply 70% isopropyl alcohol in the venipuncture area.
Very good. Good job.
And the disinfectant, a substance used to destroy disease that is producing microorganisms, but necessarily their spores. Usually applied to inanimate object.
Inanimate, non-living.
Yeah.
We don't apply bleach before venipuncture, but definitely we apply the antiseptic. Okay?
Yes, ma'am. And the example is the blood spill in the, like when you're drawing blood, accidentally spill the blood from
in the lab.
Yeah, in the phlebotomy area or in the phlebotomy chair.
Very good.
This you have to use the bleach
Very
solution.
Good. Good job. Now, others agree. Amina, go ahead.
Yeah, I just wanted to point out that it should be very much noted that the antiseptic does not necessarily kill the spores,
Hmm.
but the disinfectant does. So although the
Yes.
antiseptic kills the disease-causing organisms, but it doesn't kill their spores.
Yeah, that's why we autoclave.
Yes.
That's why we autoclave. We put it in autoclave. Yes, very good. Any other point? Others, most welcome.
Miss?
Yes.
I think I missed, because I step away a little bit. I think I missed the answer for 15. Sorry to bother you with that.
No, you can bother. What is the 15? Discuss how the above required ratio is affected by winged collection. When we use the winged collection, we have to use the discard tube when we are going to draw blood from for light blue. This much you remember.
Yes. Okay, thanks.
Just remember this part.
Yes, thank you so much.
Is it only for the light blue, the discard tube?
Yes, mainly for the light blue. Yes, because the others, if you are going to draw directly from for the red tube, you don't have to use a discard tube. Because the light blue is so sensitive that the platelet factors will be affected and the test results won't be accurate. That leads to some other thing, because we are testing the coagulation factors mainly to stop the bleeding. In case of a person is bleeding, if the blood is not arrested, it's a big issue. The person can bleed to death.
So I think one point that should be clearly stated when talking about the light blue tube is that the blood collected should be in the anaerobic condition. So that will be always clear.
Yeah. That's why when using the regular venipuncture with the regular needle, when you see the order of draw, the first one is aerobic, the second one is anaerobic. And in that way you can continue. But in the case of like a winged infusion, they say that there'll be air, so that has to be eliminated, and it should be typically an aerobic condition when it comes to the blood draw. In the regular blood draw, we have aerobic, anaerobic, light blue, SST, like that. So you have to follow the order of draw.
Yeah, but in a condition where you don't need to collect for blood cultures, and the first tube you have to collect is the blue tube with the regular, do you still need to discard?
No. Only when butterfly is used, we have to discard.
Okay.
Yes, Eveline, go ahead.
Yes, ma'am. Yeah, regarding the wing infusion set, if we're going to collect the blood culture also, and we have already collected we use the wing with the
then we collect this,
not the syringe. Do we still need to do priming or for the
they
light
do
blue?
priming anyway? They do priming. What I have seen, I have observed in the hospital.
Yes.
They collected the serum first. Then that person, I observed. For me, I was in some situation. I ended up in emergency. He used the discard tube to collect a little bit, even for serum, and the next tube following the light green. He collected the serum first, and then he used a little bit of discard, and then he collected the PST. So this is a technique that is according to the standard operating procedures of the lab, whatever the protocol is. But generally, you have to know when you're using a butterfly, it should be completely anaerobic condition. So you have to discard a little bit of blood when you're collecting the blue tube, because it won't affect the results.
Okay, ma'am. Thank you.
Okay. So you don't worry about this. Just it depends on the lab protocols, but generally they recommend when you're using the, what do you call, the butterfly. And when you're going to collect the blue tube next, then you have to use a discard just to eliminate, because to make sure the test shouldn't be altered. It's that sensitive.
Okay, thank you.
Yeah. Even, okay, just bringing up to this point, even for the capillary puncture, the doctors want to test for the coagulation factors. Nowadays, they have the light blue small microtainers. Maybe they are used in the hospital, I don't know. or we have the point of care testing as well. So I'm not sure, but what they said, what I have heard, read the information, except the APTT, there is an activated a partial prothrombin time test. Except
Yes.
that all the other factors can be tested even in the by using a microtainer. So when you come, when you study the hematology, you'll be learning it in detail, but I don't want to confuse you, but just to know, being disused, discard tube, go for the blue. Clear?
Okay, thank you. Yeah, clear.
Yeah, now draw a picture of a standard evacuation tube system, phlebotomy needle. This is exam question, once again. A phlebotomy needle, tube, evacuated tube, and label is parts. Evacuated tube means any tube. Even the picture of a syringe, you should know. Even the picture of the winged infusion of butterfly, you should know. There'll be flaps, 2 flaps at the side like a butterfly, and there'll be a needle, and there'll be a hub, and there'll be a tube, and there'll be an extended tube. So this you have to know. Draw a picture of a butterfly needle and label its parts. As I told you, draw a picture of ETS tube and label the parts. Draw a picture of a syringe, all these things. Make sure you know the parts. It's important. You will get a question with a diagram, and then you will be asked to label the parts. Describe the consequences of the following. Drawing a gray tube before other chemistry tubes. This you should know by this time, because I have explained this in comparison in the form of a chart to compare what happens, what is the additive, why some of them are in the form of a spray, why some of them is in the form of a gel, why some of them is in the form of a liquid. And this you should know, all these things. Be prepared. Now, name at least 2 factors that determine lancet choices, heel sticks or finger sticks. 2 factors, at least 2 factors. What is the maximum depth allowed for heel sticks? For adults, you should know. Max is 2.4. For adults, max 2.4. For infants, they say 2, right? And babies, newborn, they say 1.5. So 1 point starts from 1.2 to 1.5. That's it. The max you should know. And number 22nd, contrast how an SST versus PST. Now, this is, we already discussed. What is there in the SST and PST?
SST has clot activator. And the PST has anticoagulant.
That's it.
And the gel.
Very
and
good. Thixotropic. The common is a thixotropic gel.
But 2 of them, yeah.
Yeah, it is something inert compound, which means it is present inside the tube. And this is an important point that I'm talking to you. Sometimes they'll ask about this thixotropic gel in a tricky way. What they will ask, will it alter the test? No. Is anything special is added? No. Then why the gel is sitting there? Just to make it like pushing forward like a viscosity to separate and make it clear. That's it. And once when the coagulation, everything is done, and then they come back and settle in the normal way. If you keep it for a long time.
Faster clotting time.
Elastic nature, that's what we say. It can extend and come back. This, you will get a question sometimes based on the thixotropic gel. It has nothing, mainly they ask for, is there anything adding to the test? No. Is there anything to do with the test? Any change? No. It's there just to, like an elastic. So when it is under the gravitational force, mainly when it is inside the centrifuge, it helps to separate it in a better way. That's it. It will regain its position when it's left for a long time. It'll become a gel. You know the ketchup? Ketchup. When you shake, when you pour it, it'll become liquid. When you leave it for some time, it becomes the same like a paste. Best example. Do you get this, all of you? Either say yes or no.
Yes.
Yes, ma'am.
Okay, now 23rd, contrast serum specimen and plasma specimen. You now make a table put the serum in one and put the plasma in the another, column. You start picking the important points. What is serum doing? What is plasma doing? Where is serum? Where is plasma? Okay. And in which tube you will get the plasma if it's additive, and which tube you will get the serum. All those things now you have to make a chart, keep it ready whenever there's a test, even before the MLPAW, just go through these important points. It's good enough for you to get good grades. Now define the following patient states. Fasting, this you should know. Fasting, random, basal, NPO. What is NPO?
Nothing by mouth.
What? Can you please repeat? It's echoing.
Nothing
Nothing by mouth.
Nothing per mouth or nothing per orum.
Nothing per orum. Yes, it means nothing by mouth. What is basal?
It's a resting metabolic state.
Everything is like fine, right?
Yes. Like.
Yeah, I would say the glucose is more related to the glucose metabolism. Basal means even if nothing is there, the patient is not eating, insulin is needed. That's called the basal. Okay, the patient condition fasting means they are fasting. For this many hours, they haven't consumed anything. NPO, you mentioned, random means just like that. This is mainly applicable to the glucose or diabetic patients. Basal means even if the patient is not eating anything, even if the glucose formation is not there, insulin is needed. It means that much metabolism has been affected. So that's the basal. Okay.
So it's just, it's like fasting.
It's like fasting, but with a strongly irregular metabolism of glucose. Somehow the glucose is fully there in the body that has to be metabolized. Otherwise, it affects the nerves mainly. That's why insulin is given, even if they are not eating. Majority of the cases, if you eat, you take the insulin. Why? Because the metabolism is like lethargic. The glucose metabolism is lethargic and something insulin is not functioning properly. So the glucose will be accumulated in the body, not good for the cells, cellular metabolism, not good for the nerves, everything is there. And the body doesn't get energy also. But in some situations, when they are highly, highly diabetic, even though they don't consume anything, there'll be glucose, the cells will be suspended in glucose, and insulin has to be given. Mainly, I think this is associated with the people more often with the type A diabetes. Yes, Eveline?
Is it also related, ma'am, for the hemoglobin HbA1c?
Yeah, HbA1c.
The basal.
Yeah, the basal.
Yeah.
That's also there. What is that? HbA1c is to test the glucose, right? The level of, it's a glycemic index, we call.
Yes, ma'am.
So 25, discuss all the steps that should be taken if a phlebotomist has no other option but to collect blood from an arm with an IV. You know what to do. Number 26, define hemoconcentration. Yes, we know that. Define venous reflex, describe the possible consequence to the patient. Give at least 2 ways to prevent it from occurring. So what is venous reflex? If you leave the tube and the blood is not collecting, blood is not coming. If you leave the needle inside the vein for long, then due to the pressure, the anticoagulant will enter inside the veins, and then there'll be a abnormal swelling, and then it'll be painful, and then it will swell like a balloon. So you have to immediately remove that if you don't get the blood, or keep ice if you little bit of influx is there. Okay, because we don't want this type of incidences. It's very painful for the patient because now this anticoagulant is getting inside the blood, right? 28, define an arteriovenous shunt. Yes.
I have my hands up. Can we do
Break
this
time.
after? Yes, break time, please.
Okay, break time. We need
Yes.
glucose. Thank you.
Thank you.
Okay, have a nice break. Come here at 11:35.
Thank you.
Yes, ma'am. Thank
Yeah,
you.
thank you.
Thank you.
Good job,
11:30.
Asinet.
Accurate timekeeper.
Thank you, Asinet, our
Thank you,
timekeeper.
Antoinette.
Thank you so much. Hello, hello. Welcome back. Isn't that okay? I got the energy. Everyone got their energy back.
Good, miss.
We're good, miss.
Had a good break.
Yes.
All of you.
Yes, thank you for asking.
Yeah, I have to ask. Actually, I noticed the time. I was about to give the break, then I went to explain something. It's good that you reminded me. Was missing. Let me take a quick attendance. Amina. Hi, hello, Amina.
Hello.
Hello, Alcinet. I can see Alcinet Christiana.
Yes, hello.
Yes, hi.
Hi, Chris. Hi.
Hi.
Zarina Main. Zarina Main. She'll come. Eveline. Yes. Huda.
Here, ma'am.
Good job. Joanna. Yes, Joanna,
Here, ma'am.
good. Kara, I heard Kara. Lewis. Yeah, Zarina Main
Yeah.
is back.
Me?
Yes.
Okay.
Can you hear me? Oh, yeah. Good. Maris.
Here, ma'am.
Ruggiato. Ruggiato. She'll be here. Santiago.
I'm here, ma.
Ah,
Hi,
good.
miss.
Hi, Shabana.
Richard is here.
Oh, good. Shabana. Shabana. Varna. Varna
Here,
is here.
ma'am. I'm here.
I don't think Varna took a break. Did you go for a break?
I did, yes.
Ying Yang. Ying Yang, are you there? Yeah, I can see her. Yes. Yeah, Yusra.
Yes, I'm here.
Good job. Zineda.
Here, ma'am.
Yes. So, Shabana will be joining. Anyways, how was the revision, guys? Too much? Okay, interesting, boring,
Very interesting.
boring.
I think it's great.
Why learning so much? Because we are in that field. Thank God you're not learning the binomial nomenclature, the names of the organisms, everything. That's really tough. Memorize. Right? So, how do you feel about the revision? Is it helping you? You feel comfortable? You feel that, okay, we can do the test in a good way, or we will be fine?
We will be fine, hopefully, ma'am. With
Hopefully.
reading.
Yes, we have to talk about the topic, right? I want to hear everyone's opinion, like it's overwhelming or it's boring. It's okay, ma'am, to continue.
It's interesting.
Interesting.
Yeah.
So because if you don't have the interest, you cannot retain the information. It will be like, oh my God, we have to learn this. But yes, we have to learn more. Why? Because it's our job, and we have chosen a career path where we are going to land in the busiest platform. But you'll be right. But it'll be interesting. In the beginning, I was really, really frustrated because it's everything is new. The analyzers are new. And then we have to do this, we have to do that. I was running from here to there. Then slowly, like I think for 3 months, it was tough for me. Then now I'm so used to, now I know how to organize and I know how to function. So it's everything is like amazing. It happens. So you don't have to worry about it. My point is, if you know the information, and in the beginning, even if you feel there is a difficulty, it's okay. Just carry on. Anyways, we have to work. We have to pay our bills. We have to pay for our expenses. This job is not a bad job. It's a better field that you have selected. Keep that in mind. Okay. Can we continue, all of you? Any questions? Hi, welcome back, Shabana. Good to see you in the class. Okay,
Thank you,
next.
ma'am.
You're most welcome. So we stopped at question number 28. Arteriovenous shunt. You should know. Just know what it is. Like when you get questioned based on that, you should be able to pick the right answer. Difference between a fistula and a graft. What does the phlebotomist need to know about this one? You cannot touch it. This is the one thing that you have to know. You cannot touch it. You shouldn't get the blood from there. Pick another arm. This is the one thing that you have to know. And define vascular access device. All these devices that is connected in the body artificially to help the patients, mainly who are associated with the dialysis or some other treatment, you should know that you have to be very careful. And this is touching that or operating that or collecting blood from that is not the scope of practice for us as a technician, period. Okay, and examples of central venous catheters, we have seen that yesterday in the slide, and those devices that are not the CVCs, the peripheral devices, you have to know. Okay. Now the 30th question, this hemolysis or hemolysis, and how it affects the test results, you have to know. And 31st question, contrast the vacuum tube method blood collection to dermal puncture. This I want to explain. Now, what is a skin puncture?
Capillary puncture.
Capillary puncture.
Capillary.
What is a dermal puncture?
Capillary.
What is a capillary puncture?
It's also skin
Dermal
puncture.
puncture.
Skin
Skin puncture,
Puncture.
capillary.
Something other than the
dermal.
venous blood. You are collecting the blood where?
That's
Where?
capillary.
I'm not asking the method. Where? Where will you collect?
Fingers.
The middle fingers in the middle
Middle
and
or
ring
ring.
fingers.
Very good. That's what I want. The middle and the ring finger.
Ring
Sometimes you
fingers.
will get a question. Where will you perform the capillary puncture? Option A, ring finger. Option B, middle finger. Option C, A and B. Option D, index finger. Option E, thumb. So you have to know which one to pick. Okay? And the advantages and disadvantages. Do you think every test can be, every analyte can be tested when using skin puncture? No, only few things you can see, not everything you can see. So in that case, venous or venipuncture is the best. Even for collection, that is the best. If you don't get it, it's a different story, but if you get it, you get blood. But imagine you are just squeezing the finger. I've seen this. And then now you miss no blood. That's how it happens. Okay. So this is the venipuncture is the easiest method. Just put some skill, learn some skill. You're good to go. Okay. Why do we use the skin puncture? What are the conditions for using a skin puncture that you have to know? We use the skin puncture because da. What is the da? Pill. And geriatric patient, because we don't get the blood and then the veins will be collapsed in the fragile veins. And then if we insert the sclerosed veins, if we insert the needle, we won't get the blood. That's why we took the option of the capillary puncture. And describe, 32nd question. Describe how each of the following pre-analytical factors affect a patient's specimen. This is, as a technician, you have to come up with the important points. Give some examples. Age. Do you think age matters when it comes to phlebotomy?
Yes.
Yes, definitely.
Collection, yes.
Yes.
Yes, miss.
Altitude.
Yes, it does.
Yes.
Yes,
Definitely,
it
yeah.
affects the results, definitely. Test results. Why? Because the higher the altitude, first what happens, I talked about this in the class. The higher the altitude, what happens, oxygen is less and leads to sickle cell anemia. That's one condition. Before this, the blood cells struggle to get the oxygen somewhere. So what will happen? More RBCs will be produced. You will learn this in hematology.
That's
We call
right.
this polycythemia. More blood cells will be produced, and you can see small cells, immature RBCs in the blood. Why? Somehow the hormones or enzymes from the brain is sending the signal, look, oxygen supply not enough. So that will pull the bone marrow to just do their job effectively. So now more RBCs are produced. You will see the immature RBCs, but they will be destroyed eventually, because the more production, more destruction has to happen. So you won't still get the blood. We call this polycythemia. There will be anemia associated with this. Okay, so altitude also affects the test results, and body position, of course. Body position. You won't get the blood properly if you just sit in a very relaxed position. The hand should be straight. The position should be fine, right? Because the body position may cause stress in the body. And because there is a stress, who comes out first to help you? The WBCs. We have talked about it. So the test results will be altered. And pregnancy, of course, the hormone levels will be high, the stress levels will be high. So you have to, the test results will vary. And what about the exercise? Yes, strenuous exercise. When you come, something will be up, something will be down. So you have to let the patient relax and then collect the blood. Diurnal variation, yes, the diurnal variation means it's the biological clock that comes here. That is the not enough sleep, being awake for long hours, or sleeping for long hours. Both of them affect the or alter the test results. So there is a time limit how many hours you have to sleep. Then you have to sleep, because there are some hormones that are released basically based on this. Because of the hormonal effect, the metabolism alters and brings some changes in the body. Because of the alteration of the metabolism, the blood components that are released in the blood will be, something will be high, something will be low. It won't be accurate. So whenever you want to go for the collection, even for yourself, drink lots and lots of water, relax, okay? And keep one thing in mind, we are going to just give a little bit of blood. It's okay. We will be getting more blood. No worries. And even if the patient is anemic, no worries. There are different things that you can consume. Eat dates, beetroot, carrot juice, ABC juice. Have you heard about the ABC juice? Apple, beetroot, and carrot juice. You drink for 3 days, go for the blood test. Any anemic patient will get the kick of the blood. ABC juice. Nowadays, there is one company, they are marketing these juices with the FDA approved. And then you can just, for each day, for 30 days, there is a bottle. If someone is anemic, mainly the people who are the CEOs, who are busy people, they just go for this, and then you receive the package for 30 days in what do you call, in the courier service. Each day, one bottle. You don't even have to worry about it. Organic, but expensive if you don't have time. Why? They want to maintain the blood level. They want to maintain everything in their body. It's all learned. I'm giving you the tips, guys. So know these factors. It's good for you. How can a phlebotomist, 33, how can a phlebotomist tell if they have accidentally punctured an artery? Now, this is a question for you. You did a venipuncture. You hit an artery. Oops.
The patient's face.
Numbness. There's a
The
numbness.
nerves.
A nerve hit.
There is a numbness in the part.
I'm not asking about the nerves here. I'm asking about the artery here.
It's just bright red blood.
Bright red
The
blood?
color of
Yes,
the
there
blood
will
will be
be a
bright
sound
red.
called ouch. Definitely there will be an ouch. But in
Ouch
that
from the
ouch,
patient.
yes, in that ouch, there is no burning sensation, but you get a different blood. Bright
Yeah, it's
red
going to be
blood.
bright red.
Bright red. But when you hit a nerve, there'll be a ouch, there'll be an ah, there'll be, oh my God, there'll be burning. So many things coming together as a package. Clear?
Clear.
Yes. And you should know now. 34th question. Describe when and why a phlebotomist should suspect that a vein has collapsed. How will the phlebotomist resolve the issue during the collection and for future collections? Okay, you are doing a venipuncture and now you realize the vein is collapsed. How will you know? How will you explain?
For example, there is already a small amount of blood that gone in, but it stopped.
It means sometimes what if there is no blood, but it stops?
If
And an
there's no
old
blood
patient, you look at him, nothing is coming. Means it's
and
collapsed.
fail.
Yeah.
So it just stop.
It stop.
The venipuncture.
Smaller veins can collapse the veins.
So only the smaller veins, not for an old patient, even the bigger veins can collapse because
Fragile.
Yeah, the
fragile
geriatric patients,
yes.
fragile veins.
Fragile veins, sometimes sclerosed veins, they won't get the blood. So here they're talking about the collapsible condition. When do you feel that, oh my God, it's collapsed? When you insert, you see the vein, everything looks good. When you insert, nothing comes out, but you will feel that there's nothing coming out. It means it's a collapse. It's collapsed.
Oh yes, ma'am, and it's no longer palpable actually.
Yeah.
Won't
No
be
longer
able to
palpable.
feel
No
it.
elasticity will be there. That's how you feel, oh my God, this is done.
That's right.
What about the rolling
Especially for
veins?
that.
What about the rolling veins? Yes, Hingong? Question, please.
Yes, sorry, ma'am. So when we collecting the blood from patient, how we can fear the collapse vein?
Collapse vein? That's what, okay.
How we can, what is fear we can when we collect, like the insert the needle?
You insert the needle, the vein looks like clear, it looks superficial, and then you insert it, you feel that it's palpating, but when you insert the needle inside for a couple of seconds, you won't get anything. It means it's collapsed. Something is closed.
Okay, like we do, everything is right.
Everything is right. Even the vein palpated, now it's closed due to some reason, we don't know. Immediately pull it out. Okay? And this happens mainly with the old patient, with an old patient. The veins will look so bumpy, you will feel it. And but it's natural to collapse because the cavity inside the vein will be very, 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 very small, because the veins, the outside to inside of the veins will be like slowly narrowing. Why it's narrowing? Because of the old age, because of the deposition of something, it becomes more membranous. Now, okay, if you have a vein like this, you can see, but when it's coming like this, even though you poke in the middle, then now it collapses. This is what is happening, narrowing of the veins. Okay, it can happen to a healthy patient also. We don't know, something might have happened or triggered. But is it clear, Ping Hong?
Yes, correct.
There is one more term called a rolling vein. What is the rolling vein here? Rolling vein is something, the vein will be there when you palpate. You insert the needle, everything will be phenomenal. All of a sudden, you see nothing is coming out. So you pull it out. But now when you pull it out, when you check the hole, like the small hole that the needle has poked, it will be appearing somewhere else, which means it has rolled. It's not in its position. Rolling not in its position, it doesn't mean it has traveled to half a kilometer. No, how much space we have? We have only limited space here. But it has moved a little bit, maybe like just 1 millimeter or maybe 0.2 millimeter, whatever it is. Now the vein has rolled and then you poked somewhere. That also happens, rolling veins. Why these rolling veins are happening, we don't know. That's why each and every individual is created in a different way. The metabolism is different. Their fingerprints are different. Their veins are different. When you go outside, when you become a phlebotomy technician, you will be surprised to see the varieties of veins, varieties. Enjoy your work. Admire.
Sorry, can't you enjoy as can't deal with the...
Enjoy. I enjoyed. One tattoo hand, next some other hand, next an old hand, next a 14-year-old hand. Enjoy. This is how you have to improve your skills. We are here, look, we are here to learn. We are here to work. Initially, in the beginning, for 2 days should be stressful. Should be stressful. Then just, if you don't get the blood, what's the big deal? You don't get it because the veins might have rolled. The veins might have collapsed. But the procedure that you are going to do should be perfect. It should be like a skilled phlebotomy technician. Yes, Maris, I'll come to you. Why I'm telling this, if you're inserting the needle and you're shaking, no. You forgot to tie the tourniquet, a big no. You forgot to remove the tube, no, no, no. You forgot to palpate, no. You forgot to anchor, no. You forgot to put the cotton there. You're looking for the cotton somewhere. Oh my God, it's there. Oh, I'm sorry. You cannot say this to the patient. These techniques should be there, updated. You should be a skilled technician. No one is going to blame you when you don't get the blood, but people will blame you if you mess up with these things. It's a big mess.
Takes practice.
Okay, you have to calm down. You have to talk to yourself. You know what? I think I have to practice more. That's it. You're not going to please me. If I'm there, okay, I'm telling you may not like, but the real thing is you're going to face the world. That'll be even worse. That's why the training is, because we are going to be considered as a phlebotomy technician. And above all, you're going to perform a skill that is considered under the Controlled Act. You're poking someone's skin, not a joke. And you're like a vampire collecting the blood. Already they are panicky because of the skin poke, needle poke, blood collection. Now, on top of that, if you make mistakes, they will lose the confidence. And remember, that's how the communication's coming into effect. We are the intimate people now. They have to trust us. If they don't trust us, it means they won't feel comfortable. And now they will develop the stress. And you know what will happen if the body is stressed, the results won't be accurate. You won't get the proper blood flow. And what's the point? Clear? Yes, Maris, what's your question?
It's about for the collapsing veins. Can anchoring helps at least?
Anchoring helps. Anchoring helps.
Okay.
That's why
That's
we
my
tell, it's a
question.
good point that you brought in, anchoring helps. The first thing is you hold the position of the hand, anchor with your thumb, not at the bottom. I have seen many of you anchoring, but at the bottom, somewhere in the wrist. We don't want that. We want somewhere close where the thumb is steady to pull the skin and then holding the hand. That's why the anchoring is important. Once again, I'm repeating this. Tourniquet, palpate, remove the tourniquet, and then set up. Now the setup means After removing the tourniquet, then you first you palpate, right? Then you apply the what? The thing, the alcohol. Remove the tourniquet, prepare your station. Preparing the station means inserting the needle, keeping the adapter ready. Cotton, alcohol, needle, look at the requisition, the tubes that you need, and you have to be ready with the order of draw. That's important thing. So everything should be ready. Quick look, 6 things. Is it 6? 5? How many
7.
things? 7 things. Very good. So everything should be ready. Now start the procedure. First tie the tourniquet and then insert. Once when you wipe with the isopropyl alcohol, everything as an antiseptic, then don't go touch. If you're touching, that's okay. Take your time, wipe it again. The patient may object. He won't be comfortable to give their hand. Okay? So keeping that in mind, we have to use the proper skills, guys. And then labeling, there's another important identification. A major pre-analytical error that they see in the lab, identification. That's why, according to DASH, labeling in front of the patient has been mandated. According to who?
According to CLSI.
CLSI. Don't forget this. Okay, very good. Okay, so I'll pull the slides for some questions and I will tell you the topics that you have to focus for your exam. Let me come up with this one. I think I want someone to mute. Who's that one that person has to mute? Okay, Amina, I think has to mute. That's okay, it's muted. So the topics that you have to focus on, one is the communication. I told you already. That's the kinesics. Today we learned the proxemics, intimate space. Okay, if they ask something like that, 1 or 2 questions usually will be from there. So you please go through that information, the proxemics. Definition for proxemics, what are the 4 types? What are the 4 types? How many spaces are there?
We have 4.
4. What are they? Intimate space?
Intimate,
Public space, personal
social,
space, and
personal.
social.
Social. So in that, they will ask a question where you are there, which means usually they ask for the intimate space. Okay. And when you're going to take advanced exams like the not the MLPAW, the CSMLS, they ask more questions. If a person is standing like 20 feet away, what do you consider that space? Okay, so that type of question. But as a technician, intimate space is important, proxemics is important. Now it comes under which category of communication?
Non-verbal.
Non-verbal, very good, very good. So now the important topics include aliquoting. Why do you think blood should be aliquoted? Within how many hours it has to be aliquoted? Okay, according to the CLSI, for how many hours? Within how many hours a serum or a plasma has to be aliquoted?
Within
2 hours.
Within 2 hours. Very good. These type of questions are very important. Amina, can you mute, please? How is the whole blood? Okay, when you just require blood for the testing, you want something like a whole blood. What are the procedures to get the whole blood? How will you get a whole blood?
collected with an anticoagulant or anticoagulated tube.
Anticoagulant, yes, very good. And why do you think, you know, for the venipuncture, we use the antecubital fossa? Why do you think that's important?
It's the safest, ma'am, and it's more
The safest, it's big, and then it's like it won't roll that easily.
Yes.
And then it's a good site for, what are the other sites?
Basilic and cephalic.
Cephalic
Yes,
and
this you should know. And when you're collecting the blood, you bring the tube like slantingly, like tilted downwards, right? In the blood collection, why?
to avoid the reflux of the anticoagulant.
To avoid the reflex, and not only that, just to mix the blood well, that also.
Yeah, okay.
It'll be mixed, okay? And now, there is an anticoagulant in the green tube, for example. And now you're going to draw the blood. What will happen when blood is collected in this type of anticoagulant, in the green colored tube? What's happening? Green tube. What is the anticoagulant? Anticoagulant green tube.
Lithium heparin.
Lithium heparin.
So what happens when the blood enters in this tube?
It's chelating the calcium, binding
the calcium, but what is there to bind the calcium?
I'm sorry, ma'am, what's the question?
What is the anticoagulant that binds the calcium?
Is it lithium?
Sodium heparin.
It's
heparin.
Heparin is the correct answer. Heparin has to do with that, okay?
Yes.
Good. It means it makes the blood flow. Do you think heparin is in the blood in natural condition?
Yes.
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 You also have heparin in the WBCs, especially when it comes to differential. You will learn that in hematology. I don't want to dump with more information. Just know this. Yes, our body has heparin in natural condition. That's why the blood flow is maintained. Now, why do you think the tourniquet is important?
To locate the vein?
So easy palpate the veins.
Easy palpation.
Yeah,
Any other use of tourniquet?
It becomes becomes the vein enlarged and prominent.
Prominent. That means it will hold the blood veins in its position, and the blood will be there, ready to flow. That's why it shouldn't be more than a minute. What will happen if it's more than a minute? The blood will pool here around, and then it will pass on to the other tissues, causing damage. Okay, that's called the hemoconcentration, or the blood will concentrate in that area.
Yeah.
Okay. And I told you have to know how to convert the time, the military time. Okay.
Yes.
And yes, sometimes they will give the military time and they will ask you to the normal time. So you have to be thorough. For example, if the time is 13:50 at the time of collection, what is the regular time according to you? Then you have to say 13:50, then
150.
150. Very good. And you have to know the correct order of draw. What comes first? 2 culture bottles, aerobic, anaerobic, then the blue, then the SST or red or SST. Then comes what?
Green.
Green. Then comes
Lavender.
Then comes
Pink.
Gray.
Pink, or then gray.
Gray. And then
At the
yellow.
end comes the black tube. Sometimes they ask a question. What is the black tube useful for? It is useful for collect. Very good. What is the ratio of, what is the anticoagulant?
Sodium citrate.
Very good. Now, what is the ratio of anticoagulant to blood?
4:1.
1:4.
Anticoagulant to blood, that is 1:4.
1:4.
Blood to anticoagulant 4:1. Be careful, okay? And now look at the sentence, how they coin the words in the question. Accordingly, pick the answer. This is where we rush. Oh, we see 4:1. Okay, now our mind says click, we click, but they might have asked in a different way. Clear?
Yes.
Yes,
Yes.
clear.
Very good. Now, which color stopper you can, okay, now for collecting the CBC, complete blood count, what do you see in the complete blood count? What are the tests?
Hemoglobin,
RBC,
PCV,
Blood grouping.
blood grouping.
hematocrit.
Hematocrit. Very good. Good job. Now, now we see the differential also. Differential because you'll be learning the hematology. Differential means we have different cellular components when it comes to the WBC, the white blood cells. For example, we have leukocytes. We have the leukocytes has a lymphocyte. Then we have eosinophil, neutrophil, basophil, monocytes. This also can be seen using the whole blood. For now, you don't have to worry about the differential because anyways, you'll be learning in the hematology. Just to know, the test for CBC is mainly to look for the blood components, mainly associated with the blood. Okay. Now, which will be the preference for the venipuncture collection? The vein. Which vein is the
Vacutainer.
preference?
Oh,
Veins. Veins.
the
Just
vein
now.
is the
Cubital.
median cubital.
Number one. The next one?
Cephalic vein.
Cephalic.
Median cephalic.
Okay, cephalic, then?
Basilic.
Basilic vein.
How many of you feel that is hard to remember? How many of you feel it's hard to remember?
No, miss.
Everyone
I don't
is.
think.
You who think that this is you
With
don't
me,
get
it's
the
good.
question? You don't understand the question?
We understand it. I think when everyone gets quiet, they don't have anything to say. Like they're not, they don't find it confusing. They're not having a hard time.
Okay, that's good. That's a good explanation. So here, based on what Kara said, I can move further. For example, someone thinks the cephalic vein is here towards the, which is close to the body. And someone thinks that, what do you call the basilic is the other side of the median. Median cubital, everyone knows about the median cubital. So in picking the basilic and the cephalic, do you have any confusion? That's my question. If no, we can proceed next.
No.
Okay.
No, ma'am.
Okay, which one will increase if we tie the tourniquet for a long time?
Almost everything, ma'am. There will be hemoconcentration.
Everything. Mainly the potassium levels. This you should know, the potassium levels. Okay. So can you use a sodium heparin tube to test the sodium in the blood?
No.
What will happen? Will it decrease, falsely decrease, or falsely increase?
Falsely increase.
Falsely increase.
You know
Yes,
about
miss.
the thixotropic gel, the nature of the thixotropic gel. Where is it present? What is its role? Okay. And what is the best practice of labeling a specimen? You just send the patient home and label, or just you label in front of him?
Label in front of the
Beside or in
patient.
front of the patient.
Yeah. Okay. You should know when we centrifuge the tubes, what are the tubes that will give the plasma? Which tubes will give the plasma? Which tubes will give the serum?
The lavender for the
Lavender for
plasma,
the
the serum for the
is
gold.
Red and SST will give the serum, the others will give the plasma.
Yeah.
Am I right? Yes, very good. Okay, what will happen if an angle is less than 50 degrees in venipuncture? What will happen?
50?
You go about
15 degrees.
less than 15, you will miss the vein. Of
Miss
super
the
vein.
vein. Why? Why? Because the option will ask you different things. But remember, if you see it's something parallel to the vein and you will miss the vein. That you have to pick. That's the right answer. If it's less than 15 degrees, the needle won't poke the vein. It will go parallel to the vein and it won't hit the cavity of the vein. Okay. Now, do you know the workflow in a lab? What is the pre-analytical, analytical, post-analytical? What happens in the pre-analytical? What happens in the analytical procedure? What happens in the post-analytical? You have to be thorough with this. So identification comes where?
Pre-analytical.
Pre-analytical.
Pre-analytical. Testing procedure, where?
Analytical.
Analytical.
Post-analytical?
Retention. and,
Retention,
Yeah,
storing.
attention, releasing of the
storage.
results, everything. Okay, good. You should know about the turnaround time. What is the turnaround time? Short turnaround time is STAT, ASAP. Okay,
As soon as possible.
and yes, and you have to know fasting blood range. Okay, and routine. You have to know what is the routine, what is the fasting, and what is the range. Everything. Next. And you should know mainly the gray. Even though we don't have gray in usage, even in the lab, I'm not seeing more of the gray ones. They ask, what is there inside the gray tube? Two things are there. What are they?
Sodium fluoride and potassium oxalate.
Very good. Okay. And what is the role of the, what do you call the potassium oxalate?
It's an anticoagulant.
What is the role of the sodium fluoride?
It's
preservative.
Preserve the glycolysis.
Prevents
Preserves the sugar.
glycolysis. Yes, very good. Now, one thing you have to know while collecting the blood, mainly this is some questions is scenario based. If you're going there in the hospital, you're going to collect the blood. What are the first thing that you have to check to identify the patient? Mainly the newborn. What do you have to do?
The label. The wristband.
Wristband with the nurse. For the newborn, yeah, wristband with the nurse, and also for the unconscious patient. I'm repeating this because this is that important.
Call the nurse.
Nurse, you do the puncture. Even if you have the wristband, everything, if the patient is unconscious, there may be like so many reasons that might have happened. Mainly the needle stick injury, because they may all of a sudden wake up and then if they shake their hand, it's no good. So someone should be there in order to hold the hand if it's an unconscious patient. For conscious patients, of course, you don't have to ask the nurse. You just tell them you're there and then just look for at this situation, you look for the ID wristband and then you document and then you do your work. Clear? Don't confuse with this because these are important things that you have to consider. Which of the following areas should be avoided when collecting blood from a patient? Can you collect the blood from the hematoma area?
No.
No.
And any burnt area?
No.
Petechiae?
Yes.
Yes, you can.
Yes. Arm on the opposite side of mastectomy?
Yes.
You have to do that, right? And what about the fresh tattoos? If the tattoos are fresh,
No.
no. They are prone to infection. That's fine. And now, the maximum depth for a lancet to penetrate the newborn, an adult. Okay, so you have to know the range. And which of the following is okay, now when you're using the capillary puncture, you're going to use the lancet. So what will you consider? Will you consider keeping it, using it and making it sterile and keeping it? Or it's just use and throw, one time use only?
Use one time.
Only
use.
one time use.
Okay.
Only.
If a patient is visually impaired, he cannot see properly, how will you communicate with them? Will you talk to them clearly and loudly, or will you write it in a paper, or will you bring someone to talk? What will you do?
Narrate the procedure.
Narrate the procedure. Very good. Good job. Now, What is the word for bruising? Another word for bruising. Do you call this hematuria?
Hematoma.
Hematoma. Very good. Always, always know the order of draw for microtainer. You know the regular order of draw. What is the order of draw for a microtainer?
It's in reverse. The
Hmm.
opposite
Yeah.
of the vacuum
Blood
It's,
culture.
it's editor, and
Editor, other additives and
and then
serum. Yeah,
serum.
very good, very good. What will happen if you're doing the capillary puncture and you're milking the skin?
Contaminated with tissue fluid.
Contaminated with the
It increases
tissue.
the hemolysis.
Increased chance of
Hemolysis. Very
hemolysis.
good. Hemolysis. Very good. And how will you transfer the blood into the syringe? What is the correct procedure?
Using a pipette, transferred pipette.
Transferred, but yeah.
How will you transfer the blood collected in a syringe?
You use the vacutainer and the adapter. And
And you use one more thing, syringe into
vacuum.
blood tubes. There should be a protective guard. You have to, mainly what is that? An adapter should be there.
It's what holds the vacutainer tubes.
Yeah, that's to hold it, to avoid any injury, because it's a correct method. You're going to poke it inside. You're going to poke the needle inside the tube and then you invert it and slowly the blood will be collected. Okay. And now, so you're collecting the blood and there'll be blood loss. The blood loss is because of over collection. What is the term that you use?
Iatrogenic.
Iatrogenic anemia. This
Anemia.
happens where? In which situation this thing happens?
Usually with elderly and infants.
Patients who are in the hospital. For example, for 3-4 days, they are there. And every time for the doctor wants the blood to be seen, they are looking for something. Then you have no other choice. As a technician, go poke and take it and then release the results. Now, a radiating pain. We have to talk about this. A radiating pain in the hand, like where you cannot bear, tolerate. What could that be?
Hit the nerve.
Hit a nerve. Very good. What do you have to do? Wait for the patient to tell, remove?
Remove immediately.
Immediately.
Remove the
Otherwise, like
tourniquet
there will
and
be
remove
like
the
a nerve damage, right? And then the parts of a syringe, parts of a butterfly, parts of what do you call? Butterfly, regular needle. You have to know everything. What is a barrel? What is the hub? What is a needle? If it's a syringe, if it's a regular poking thing, you have to know which one is like going inside the tube, where the needle will go. So those parts you have to be thorough with. Okay. So why do you think sometimes when you're collecting a blood from an old patient, for example, a stroke patient, what are the difficulties that you can face?
Body position.
Body position. A paralyzed patient, like for example, half of the body is not cooperating because there is something, paralysis has happened. There's no control in this. So where will you collect the blood? Can you collect the blood on that side?
No.
The other side.
The other side, the unaffected.
When you want to collect the blood from the other side, what are the difficulties that you may come up with? For example, the veins look prominent, the veins are standing, and then you're palpating well. What are the possibilities that you may get the blood or you may not get the blood? What are the chances of getting the blood and not getting the blood? What are the chances?
Vein might collapse.
Sclerosed. In that situation, now what is the other technique that you have to follow as a technician?
Use the wing butterfly collection with
butterfly collection, because the lumen might be very narrow or the cavity will be narrow.
Yeah.
And even then you're not getting the blood. Now what will you do?
Capillary.
Last resort.
Capillary.
Capillary, very good.
Capillary.
Capillary. Now, which finger will you prick?
The other side.
Middle.
is
Two
not
Very
The
good.
correct.
This you know.
unaffected
You're
side.
very good in this. Okay. So, another tricky question. So now you're going to do the capillary puncture. Now you have to warm up in such a way. You have to start from here, this part. Okay. Don't just pull the finger like this. Poor guys. They'll be feeling bad, stressed and everything because it's too much for them. You have to start gently from here. And what do you think should be the temperature of the finger to poke?
It should be higher, right? Typically.
Little bit
40.
higher. Very good. 40.
Yeah, like
42.
42 degrees centigrade.
For how many minutes?
5 minutes.
Very
Five.
good. Good job. Now, if a child is asking, you're performing a phlebotomy on a 3-year-old, and that child can talk fluently, and then now the child is panicky, and then she's asking you a question, for example, will it hurt? So what should be your
Yeah.
answer?
Yes, it will
It hurts
hurt,
a little
So,
bit.
but it will come over quickly.
It's come out.
Yes,
Yes,
very
so-
good. Yes. Yes, someone want to ask something? Nothing? Okay. So what if the child says, I am scared of needles?
Will
Okay,
distract,
you're telling the child,
distract them.
okay, yes, it will hurt. Of course, you will come out of it, but yes, very good. Distract them. How? Ask them about their favorite hobbies, like with their close friend. Like how do you do something, like do you know rhymes, or do you know how counting, or something to distract? If they're curious, just you do your job talking. Okay. And this now a physician says collect the blood, and the blood collection, the requisition shows you have to collect, based on the requisition, you're going to collect a light blue tube, and you're going to collect an SST tube, and you're going to collect a lavender tube. Okay. And now you have decided to use a syringe. How many ml of blood can you collect? Can that be 10
20.
ml, 20 ml, 30 ml?
20.
Yes, 20. 20 is the regular size. Very good. Okay. For the neonatal screening card, we know within how many hours we have to collect. What if the newborn baby has to be in an ICU due to some reasons? How many days?
7
You have
days.
to
7
wait for
days.
7 days.
Seven.
Very good. Very good. There will be, for example, you're seeing a technologist, and the technologist is using the microscope, right? And then she is putting her effort to see the slide. What is the branch of science that deals with the usage of the equipments and how to protect yourself from any injury is called?
Ergonomics.
Ergonomics. Very good. When it comes to culture and sensitivity testing, what do you have to use to collect the blood? Culture and sensitivity testing we're talking about. So this culture and sensitivity blood collection will go where?
The blood culture bottles.
Very good. Is there, if you want like 20 ml, that's fine. If you just want 5 ml to see something, what is the tube that you're going to use?
It's 10.
Pale,
Oh,
Pale,
yellow.
pale yellow. Very good.
yes, the
Pale
pale
yellow.
yellow.
Good job. Good job. What is the anticoagulant? Does it have any anticoagulant?
Yes, it is.
What is the name of
Yes.
the anticoagulant?
SPS.
What is the full form of SPS?
Sodium polyanetol sulfonate.
Very
Sulfate.
good. This question you will get in the ML POW, you'll get in the final exam, you may get in the safety final exam. So please record it, record it. Okay. And mainly, they have to collect that in a sterile container. Whatever it is, it has to be sterile. This is one thing you have to know. Even in the case of urine for culture and sensitivity, do we collect urine for culture and sensitivity?
Yes.
Yes.
Where?
Patient.
The patient has
Or-
to collect and bring. Yes, very good.
Yes.
Why do you think we have to like collect the, how will you instruct the patient to collect the blood if it's culture and sensitivity?
Blood or urine, ma'am?
Urine.
Will be midstream.
Very good.
Midstream.
Clean catch. MSU. Okay. Now, if a patient is coming to you and the patient is sitting there, you have to collect 4 tubes. Now, the patient extends his arm, his or her arm. It means what type of consent is that?
Implied.
Implied
consent.
Now, look at my question. Does the patient have the right to stop the blood collection?
Yes.
Yes.
Why?
Yes.
And you have to follow that?
Yes.
Yes.
Why do you think you have to follow that?
It's the
patient's
patient's
right.
choice.
Patient's
right.
And their
right.
Yeah.
Right. And that patient, when he says stop, don't tell I have collected only in the 4th tube this much. I need a little bit more. So can I perform that? No, immediately stop. And after that, what you have to do?
Document.
Very good. Why
Yeah,
do you think you have to document?
Prior for not
To
getting
protect
the full
yourself.
blood and protect yourself.
Protect yourself. What if the doctors wants to see something in the whole blood, in the CBC, and the blood collection is not enough? Now he will call the lab. Your technician never collected the blood properly.
Yeah.
Then who is the technician? XYZ. Why didn't you collect it properly? So to avoid this, okay, we are ready to collect, we are ready to do our job, but the patient is not cooperating. So it's now my problem. Clear?
Clear.
Yes.
Okay. So you know how to perform a stat. Leave everything, immediately rush stat, right?
Yes.
Now, if you are having a non-verbal communication, what is the branch of science that is associated with this?
Proxemics.
Proxemics, right? More specifically, you are using the physical gestures. What is the branch of science that deals with this?
Kinesics.
Kinesics, very good.
Kinesics.
Very good. Good job. Now, you all know in the hospitals, when they collect the blood, they have a special system, tubing system to transport the blood. What is that called?
Pneumatic tube.
Pneumatic tube system.
Yeah, pneumatic.
What are the advantages and disadvantages of the pneumatic tube system?
Hemolysis.
Hemolysis is
This is
the
a
what?
disadvantage.
Disadvantage. Other than that, everything is fine.
Right.
Okay. Okay, now, sometimes they ask a scenario-based question. Yes. Okay. I'm muting him, huh? Okay, there are 30 patients in a room. I'll say 40 patients sitting in the room in a lineup. And you're looking at the patient outside and you are the only technician working there in the lab. You just popped outside and you said, oh my God, I have to do this within 8 hours in my shift or maybe 6 hours more. Okay, let me call the patient quickly. And then, okay, whatever XYZ is the name, you're calling the patient. Now you're not asking for fasting. You're not asking whether you faint or not. You just started the procedure. And all of a sudden the patient is fainted and they hit the head. Now the scenario goes on. Is it a right procedure to do?
No.
What you should do? What you should do?
If I'm alone, ma'am, I will call 911.
That's for the fainting patient. Yes, very good. But in the because there's a head injury, no choice. Incident report, head injury, never mind. But what mistake you made at this point?
You didn't ask the
ask
patient.
the proper questions.
Didn't ask the patient. No matter 40 people or 100 people are sitting there, you as a technician should follow the CLSI guidelines. What is that? Okay. What's your name? Last name? They have to tell, right? Last name, first name, date of birth. Are you fasting? Have you done this before? Blood thinners. At the end, allergies. Keep this in mind. Without this, you don't touch the patient. Clear?
Yes,
Now,
clear.
in the case of ova and parasite collection, there is a container and there's a preservative inside the container. What could be the preservative?
SAF,
SAF. What is the full form of SAF?
sodium acetate, acetic acid, formalin.
Very good. Okay. Now, so in the case of the fecal collection, I'm telling you again and again, the urine collection, storage, fecal collection, storage, body fluid collection and storage, the temperature, everything is important. So for how many hours you can keep the urine sample at room temperature? The max.
8 hours.
8 hours.
8 hours.
Hours.
Oh, what if you cannot keep that for a long time? What do you have to do?
Refrigerate.
Yeah.
For how many
Refrigerated.
hours? Max 24 hours, 48 hours. Then you have to discard it. That's it. Okay. So what are the two chemical substances that you use to flush the catheter of an IV?
Saline and heparin.
Saline
or
and heparin.
Heparin.
Very good. Very good. So when you use the heparin, are there chances that it can alter the test results?
Of course.
Yes.
Of course.
Yes.
You have to know this, right? What if you're using something like a photosensitive analyte? What precaution you have to take to protect the analyte before testing?
Tinted tubes or tinfoil.
Very good. Very good. You're going for a collection in a hospital, for example. You have to follow certain guidelines or you have to protect the patient's privacy. What is the first thing that you can do?
Knock the door.
Knock the door. If there is a curtain, no door.
Knock the bed.
Oh,
Knock the bed, just call tell that I'm the technician, I'm here to
Yeah.
collect the blood. Are you okay? Right? Just to make
Yes.
sure you're there. What if the patient is sleeping?
gently touch the bed.
Touch the
Gently
bed.
touch
Yes.
the blood.
Touch the bed.
Okay, gently touch the bed. What if the patient you feel it's unconscious?
I would report
Call
the
the-
nurse.
Go to the
Call the
nurse.
charge nurse and tell her to be there. What if you enter inside the room and the patient is not in a proper position, the dress is somewhere, and what will you do as a professional?
Only eye
Tell them
contact.
they're gonna come back.
Eye contact, look at their face, okay?
Right.
And then just because they are not doing it on purpose, it could be due to someone. These are the professional etiquettes that you have to follow, okay? And what if the doctor is inside the room?
Come back.
If it's
Come
a
back.
stat,
Yes, if it is a stat, yes. If it is a
stat. Regardless.
You're gonna
you're going to request them politely that you have to collect it because it doesn't matter. You have to take it immediately, right? Yes, very
Yes.
good. And now, when you're doing the venipuncture, I think I'm repeating this. What is the space that you're associated according to the communication? That's the intimate space.
intimate.
Okay?
Intimate.
Okay, yeah. Now, when will you apply the transportation of dangerous goods guidelines? When you're working in the same lab or when you have to send the samples from one lab to another lab?
From one
From
lab
one
to
sensor.
another lab.
What is the name given to that?
Inter-laboratory.
Inter-lab. What is the name given when you're transporting something in a, what do you call the cow, the cart on wheels, from one department to another department? What is that
Intra.
called?
Intra.
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 Keep this in mind. You will get questions based on this. Okay. And what is the verbal communication that you do in case of venipuncture? I'm not asking about the non-verbal communication. The verbal communication, what is the verbal communication that you do when you have to perform the phlebotomy?
Ask the patient first and last name.
Very good. Very
Yes.
good. Right?
Beautiful.
All the questions that you ask. That's the thing, right? Now, now in case of the specimen sitting in the fridge and in the room temperature, sometimes they will twist and they won't give the exact hours. They will convert it into minutes, 360 minutes, 60 minutes, 180 minutes. For example, the serum and the plasma has to be aliquoted in 60 minutes, 180 minutes, 360
120.
minutes, 180 minutes, 120 minutes. So you have to figure it out. You have to convert that in hours and then pick the right answer. Okay?
Okay.
Okay. And you know about the ergonomics. I don't have to repeat. And you should know about the lab transfer. Okay, now you should know about the SDS safety data sheets because it's a final exam, a collection of all that you have studied from the unit 1. You have to know about the SDS. Okay, who has to prepare the SDS? What the employer has to do with the SDS? How many categories are there in the SDS? And
30.
yes, so who has to prepare the SDS? Is the
Supplier.
supplier and supplier.
Supplier.
Very good, very good.
Supplier.
Okay. So which is the best way to sterilize?
Autoclave.
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 Which is the best indicator to say this has been sterilized?
Biological.
Biological.
indicator.
How many indicators are there?
Biological indicator. Chemical indicator.
Two
Three.
Two.
Chemical, two. Chemical indicator, but in the
And
form of a strip or in the form of a tape. Why we use the tape? Because to make sure this has sit inside the autoclave. That's it. But why we use the strip inside? Just to confirm again, this was inside the autoclave. But actually, which one confirms that the autoclave is working good?
Strip.
The strip. Biological.
Biological. Biological has to approve, yes, even though this has been in the autoclave, it's working good. Okay, because of the bacteria. Okay, if a patient is missing, I think we all know this. In the hospital, if a patient is missing, there'll be a color code. If there is an emergency, there is a color code. So if there is do you know the hospital color codes?
Yellow.
Yellow if the people
Oh, the yellow.
missing.
Missing is yellow, okay. What about blue?
It's
Cardiac arrest, I believe.
yes.
Black.
It's
Black.
bomb or disaster.
Yeah, there's
or
a yeah.
something.
White.
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 Missing patient.
Missing.
No, white is a crazy person on loose.
Person, yes.
So you are going to pick yellow for the missing patient. You're going to pick the white for the missing patient. What's going on? So pick one.
Yellow.
Yellow
Okay,
for
very good.
missing.
Okay. And you should know the LD50, LC50, all those things, the lethal things, okay? Okay, now, what if a patient is being infected, but still he was in hospital? What type of infection is that?
Non-sonomic.
Nosocomial.
Nosocomial infection.
Nosocomial.
Okay. Okay. For example, if a patient is having some infectious organism inside, could be a virus or bacteria, and the symptoms are not there, right? We already talked about it in the final exam crossword. What is the other name for that?
Asymptomatic.
Asymptomatic, right? The symptoms are not there. But there is another specific word that is used. What is that?
Vector.
Vector. We
Carrier.
also call carrier,
Carrier.
reservoir, host. When you get the term host, the host is considered a reservoir. This also you have to know. Just in case, if you can't find these one, when you have the reservoir, reservoir. If there's a carrier, carrier. If it's an asymptomatic, you pick the asymptomatic. All those things, okay? Then you all know, okay, what is the full form of HEPA? HEPA filter. We talked about this in the biological safety cabinet. Is high
efficiency
particulate air. You should know the full form of HEPA. Full form of BSC, biological safety cabinet. Which is the flask that gives the accurate measurement?
Volumetric.
Volumetric. Pipette releasing the accurate ones. Volumetric pipette. Okay. So to prevent the aerosols in the lab specimen, okay, where will you perform that?
BSC.
Biosafety
cabinet.
Biosafety cabinet. So this you have to know, okay?
Yeah.
Now, if a specimen is coming to the lab and you're in the collection department, I mean, you're in the procurement department, okay? Something is not considered biohazard, which means it's not related to infection. Which one could be considered not as an infection? Can you consider the blood as an infection or non-infection?
Infection.
Can you consider the body fluid as an infectious or not?
Yes.
Can you consider the radiation, something with the radiation as a biohazard or not?
Biohazard.
It is.
Yes. Biohazard.
No.
Is it not a
No.
biohazard? That is considered radiation hazard.
Oh, radiation. Yes.
Bio means anything living thing inside to cause the disease. That's why I'm asking this question. That is considered under radiation hazard, not the biohazard. Okay? It can be something, a pocket with something nuclear supply, something like that. It's not the biohazard. It's a radiation hazard. Okay? And you have to know what are the components that you can be autoclave. Can you use the glasswares? Yes, you can use. What you shouldn't use to autoclave that you have to know. I'm sorry, guys. I forgot to mute. And this fire is important. Category A, category B, category C, category K, important for the fire. Okay? And which one will you use for electrical fire? Which fire extinguisher is used for category C?
Class B.
If it is an electrical fire, which extinguisher will you see? Very good. If it is a metal?
Class B.
This is an important question. Anyways, you will get even in the final exam, in this final exam, ML Power question. Take the, I'm not going to give the answer. Take the fire.
Is the metal A, miss?
A. Class A.
Class A is for metal?
Class A is for paper, wood.
Very good. What about B?
Liquid.
It's for liquids and gases.
Those are the flammable
Oxidizing solvents and everything. Okay, next C.
Electrical.
Live electrical equipment.
Metal fires.
Appliances.
Metal is K.
Okay. C is metal.
C is fire, isn't it?
Yeah.
And the B is metal, and the A is paper or wood, right?
Mm-hmm. C is electrical.
But then, Mama,
Electrical.
we have the extinguisher A, B, C, which we use in the lab.
Okay.
So
We
it's a
use the
combination
one,
already of
the B is for general everything. Yes, it considers
yes,
everything.
A, B, C.
Yeah. So please come prepared with this question. Okay, now, when will you start the autoclave? When the desired temperature and pressure
Temperature is
reached.
being
Yes.
reached.
Yes.
15 psi.
Yeah.
121.
121 degrees centigrade.
Yeah.
And depending on the time,
Yeah.
minimum is 10, 15.
Yes. 15. Very good.
15. Yeah, 15.
15 is the answer. 15 psi per square inch. Okay. And then who has to give the WMIS training? All the information related to WMIS is important.
Employer.
What is WMIS? What is WMIS? The full form of WMIS. You will get a question.
Workplace hazardous.
Workplace.
Yes.
Hazardous.
Labeling according to WMIS. Everything is important. Or anything related to WMIS, the symbols are important. Okay. You have to know which symbol is for what. Okay, what are the three main elements in WMIS? What are the three main elements of WMIS? I'm asking you.
Employer, supplier, and
The product identifier, the SDS.
Labels.
And the
Labels.
Labels.
Storage.
Yeah.
Storage.
Now, what should be the, you know the autoclave now. What will be the temperature of an autoclave, everything you have to know. So you have to know what is the pH, what is the higher pH called, what is the lower pH called, what is the device to measure the pH, okay? And what is how will you clean a water bath? It's important, okay? Use soap and water, then 2% glutaraldehyde because it's a metal, then you have to know. And then examples of an acid and a base, you have to know. And once again, if you get a lipemic sample, if it's like very thick, cloudy, white fat is there, what is the procedure? What do you have to do further? Will you document and throw it, or will you document and don't run in the analyzer?
Yes, another ultracentrifugation.
Yes, you don't even have to document when it's a understand, listen to my words. This is important. If it is a hemolyzed specimen, yes, the technologist has to document. Okay, if it is an icteric specimen, still you can run, but the technologist has to sign, and you have to document.
put a comment.
Yeah, but if it is a lipemic, the technologist doesn't have to sign. You don't have to worry. Just do the ultracentrifuge, remove the fat, and run this specimen. Okay. Okay, what will happen if the lavender tube doesn't have enough blood? You have to know. Okay, and what if you should know the range of the fridge and the freezer temperature? If something even 1 degree goes below, inform this to the manager, supervisor, or whatever, whoever is there. Okay, so if a patient is on IV, what could be the reason for the light colored, the specimen or diluted specimen? You have to know that's contamination then, okay? And the microscope, mainly the color illumination, just go through that. What will happen if the blood tubes are expired?
It will not vacuum.
Vacuum is good.
Yes.
Yeah.
Yeah.
Short of straw.
And it
Throw
will
it.
be,
Yeah,
yes.
the vacuum will be, yes. The test results will vary. It won't be the good result, okay? Okay, now, what should be the temperature of the yeast to be grown in an incubator? Is it the same 37 degrees?
No,
More than that.
it's
More.
20 to 25 degrees centigrade.
20, less
below.
than that, less
Yes,
than
less
the,
than
yes, less than that, okay? And you have to know the refrigerator temperature range, guys, and the optimal temperature for the fridge, 4 degrees.
4, yeah.
4 degrees, okay? And what else? You don't want any bacterial growth in an incubator. What will you do? Add what? A phenolic detergent. Okay? Phenolic detergent. This is important.
That's for the water bath. Water bath, ma'am.
It's for the water. Yeah, it's for the water bath. So what was the question? I forgot. 1 second.
You will add into the water bath to prevent
multiplication of bacteria.
Yeah, bacteria. Okay, very
Yes.
good. So you have to know what is a neutral pH. Now, for testing the pH, what are the bottles that you used in the lab? Do you remember? One to check the neutral, one for 7, one for I think 4, 7, and 10. You have to know this.
7, 10, yes.
4, 7, 10. Okay. Why the sample is hemolyzed? What could be the reason? You all should know, right? And the invasive procedures. When you collect the invasive procedures in the procurement area, what if you find some label is not proper? Will you throw the sample? Will you reject it? What will you do? The next procedure.
Contact the physician.
Physician. Yeah, very good. This is their responsibility. So you have to contact them, let them know, and they will do the job. And how to use the lenses, how will you multiply for the magnification? You have to know. For example, you're using IPs as 10x. IP is 10x. Now you're looking at the object, whatever object that could be. But if you're looking at the object for 10x, what will be the magnification?
100.
100.
This you have to know how to calculate. So all the other safety things we talked about, please go through that, all the sheets that I gave it to you, go through that in detail. And that's the revision for today. So tomorrow, I'll be there with you from 9 to 10 or 10:30. After that, you're on your own, do your work with the papers. Even though I will monitor you, I'll be there. Now, that's your totally free time to revise. Tomorrow, revision on your own. If you have any question, you can chat or you can contact me because I'll be there with you. But it's totally a revision day for you for tomorrow. We can talk from 9 to 10. After that, it's a totally revision day. When Munmun comes, if you're ready for the exam, tell the next week on Friday you can take the exam because I have prepared you enough with the information. You're good to go. Okay? Good luck for your preparation. Now, those who want the, what do you call, the final exam or any other papers, please text me how many copies I have to. I'm going to the college today and make copies and leave it on the Munmun's desk. Got it? Have a wonderful day. Prepare well. Any questions? Please let me know.
Mom, I have a question. It's Verna. Do we have to stay until 1 o'clock tomorrow or?
No, just 12, 12:15, max 12:30. You're good to go.
Okay, thank
But
you.
you have papers in front of you. You're working on it and then I'll be monitoring you. But still, I'll be monitoring till 12, not more than that. Because your time, your revision day, you're free because I have loaded with enough information. You guys are tired with me now. You don't want to see me anymore. Just get out of and from our front because we don't want lab safety, miss. We are done, miss.
Mom, so do
Thank
you
you,
have
Miss.
any idea when is the exact date for our final exam?
The Munmun has to decide. Even I could have conducted for tomorrow, but I have more time. I cannot do that. You know what I mean? Next week, you are in the lab. You have to be in the lab. So after completing the lab hours, on Friday, if you're really ready, you can tell Munmun, but still you have 1 more week, okay? This I'm giving you as a clue. But if you want to go with the exam, finish it. Finish it, be free. And let her do the other module. Good? Good.
Yes, ma'am.
Okay, good luck for your exam. Good luck for your revision. Tomorrow I'll be there with you, but not for a long time. But I have given enough papers, enough revision. If you want any papers that you want to talk about, any final exam crossword, 4 of them, they never received it. I will leave it on the desk. If you want some other papers, please let me know. But you have to let me know before 2 o'clock because I'm going to the college today to leave all these things. So you can get it, including your test papers. Got it? Good
Yes.
luck. Have a
Yeah, thank
wonderful
you.
revision, wonderful day, sleep, enjoy. You're good with the
Thank
revision.
you.
Thank you,
you.
Mom.
Okay.
Thank you,
Thank
Ma'am.
you.
Yeah, it's
Bye,
nice
guys.
having you
Tomorrow.
as my students. I'm
See you
blessed to be with you.
tomorrow.
You're all amazing, very interesting. You listened, you observed, you enjoyed. I hope you enjoyed. I don't know.
Yes, we did.
Yeah,
Yes, we
okay.
did.
Thank you so much.
Yes.
Have a
we
nice
Thank
day.
enjoyed your
you.
Bye.
See you
class.
tomorrow. Bye.
Bye.
Thank
See you
you.
tomorrow. Bye.
Bye, everyone.
Bye. Bye.
Bye.
Thank you.
Bye.
Thank you.
Thank you.